Hey, Kulsum, how are you? Good evening, everyone, and welcome to today's wonderful afternoon. Every Sunday, we do 200 MCQs, learn where we are good, where we are not good, where we need to improve. Even a clock which is not working shows the correct time twice, right? Whatever be the kind of student you are, any student can answer 40 to 50 questions correctly out of 200. A good student can answer 120. Extraordinary student can answer around 150. So all our journey is from this 50 to reach that 150. So how can we do that? We need to do that in the next 50 grand tests that we are going to improve in every grand test. So with that preamble, let's make the great beginning, doctor. And generally, grand test, NEETPG grand test discussion, I run like a Shatabdi Express. I don't go very detailed. Apologize me for that. Because in the next couple of hours, we need to finish almost 200 questions, require a running. Somewhere, wherever the little explanation is needed, I'll try to find out. And of course, our regular gossip is a part of the game. Without that, we don't survive, right? So tachypnea, severe cyanosis in a male infant who is around 2 days, and aorta is lying anterior and to the right of the pulmonary artery on the echocardiography. So, doctor, you need to remember what are the 4 T's we discussed leading to cyanotic heart disease. Fatafat bolo, Dr. Girija. T for tricuspid atresia. T for truncus arteriosus. T for TOF. T for transposition of the great arteries. If it is TOF or tricuspid atresia, there is a decreased flow into the right side of the heart. That's the reason the pulmonary oligemia will be there. Whereas in truncus arteriosus and transposition of great arteries, there is a pulmonary plethora is what you need to basically remember. So what is this called as, doctor? This is called as egg on string appearance. Why is it called like that? Because there is a cardiomegaly that makes the heart become shaped like an egg in transposition of great arteries. But normally, why do you get some shadow here? Because of the pulmonary artery. Pulmonary artery. Here, in truncus arteriosus, aorta and pulmonary artery have become like a common vessel. That's the reason your entire aorta pulmonary artery narrowed down. That became a string on which this globular heart is hanging. String on end appearance of transposition is what you need to basically remember. Right? So, primary visual cortex is in calcarine fissure. And what is the major fissure separating the motor and sensory cortex? Sylvian. Right? Any accumulation of the blood in the sylvian fissure is a sign of which hemorrhage, epidural, or subdural, or subarachnoid, or intracerebral? Normally in the sylvian fissures, we don't find subarachnoid hemorrhage. If you find opacity in sylvian fissure, it is a sign of subarachnoid hemorrhage is what you need to remember. Middle cardiac vein. Once more, doctor, mark a note that coronary arteries, right, left, how do they arise, everything. We are going to next to take up after biochemistry, cardiology, basic sciences, anatomy, physiology, embryology of the heart and all that. Middle cardiac vein typically is in the back of the heart, posterior aspect of the heart. So the middle cardiac vein typically passes along the posterior interventricular septum. Anteriorly, you have an interventricular septum through which left anterior descending artery will be passing. Left anterior descending coronary artery, which is the branch of the left main coronary. Posterior aspect, you have a posterior interventricular groove through which the middle cardiac vein will be passing is what you have to emphatically remember for the tomorrow's exam. Good to see Abhishek and many more who are all online. So, doctor, we are looking at the back of the heart. So this is the great cardiac vein, and you are able to see the small cardiac vein, and this is the middle cardiac vein, which is passing between the left ventricle and right ventricular posterior interventricular septum is what you need to remember. The parotid abscess, why you want to always do a horizontal incision? To avoid facial nerve injury. So you don't need to read for some questions. Now you are able to get me. You can guess. But to guess, you need to have some, the simple rule. If you can't revise all 54,000 high yield facts that I gave, even if you have revised 70% of them, still you will fare well in the exam. But I want you to read 54,000 crush them, nail them, and then go and थप्पड़ मार के आना है examiner को exam hall में. That should be the goal. Okay. Then doctor, ventral pancreatic. This question you might have done right. Pakka? Very good. Because we discussed in the gastrointestinal tract embryology, we discussed this. Uncinate process of the pancreas. Norepinephrine containing neurons are predominantly there in focus ceruleus. So what happens to doctor? This does not fall under any high yield fact. In exam, you will come across this kind of things which are just asked, like what is silicon level in Pacific Ocean? Who will know? But the point is, if you are not sure, don't jump. Earth is not going to fall if you don't attempt. That is most important thing you should learn during this practice test. What to say? No. Who are the boys in the college to whom you should say no? Right? Then only the right boy comes into the life. Now comes intestine and testis. What is the glucose transporter? GLUT5. And it transports fructose. So this is one dirty list you need to remember, doctor. GLUT1 RBCs. GLUT2 is in liver. GLUT3 brain, GLUT4 adipose, skeletal and heart. GLUT5 is intestine, testis, kidney, sperm. In the sperm it transports fructose. Out of all these, GLUT4 is insulin dependent. Only glucose transporter which is insulin dependent is GLUT4. GLUT7 is in endoplasmic reticulum. GLUT6 is in leukocyte and spleen. You ask your friends to remember all that. Only you remember 1 is RBC, 3 is brain, and 4 adipose tissue, skeletal muscle, heart is typically insulin dependent. This much, and fructose by GLUT5. Now, what is the main mechanism moving the water molecules, doctor? Filtration of all the process. Once more, this you correctly answered, doctor. ICF, ECF. Correct. Lower potassium concentration. What is principal intracellular, extracellular? What is the ECF volume, ICF volume, plasma volume of the total body water? So 70 kgs Subbalakshmi got first rank in NEETPG means it is not 70 kg Subbalakshmi, but 60% of Subbalakshmi is 42 liters of Subbalakshmi is water only. So our 42 liters is studying NEETPG high yield facts, another 42 liters. All water cans I am teaching. So major cation of ECF, sodium, ICF, potassium. Anion of the ECF is chloride. And major anion of ICF is phosphate. Is what you need to remember. Donan effect means what? Whenever there is any indiffusible ion like mannitol, it will carry water with it, and that's how mannitol is a osmotic diuretic. The drug acts primarily on a receptor located in the membrane of the effector nerve. Typically, alpha 2 is presynaptic located in the brain. Clonidine is acting on that. What was your answer? Ayo. Cocaine, amphetamine, tyramine, these are all what? Indirect sympathomimetics. Whereas clonidine is alpha 2 agonist, right? And directly it will go and show its agonism. That's the point. Alkaptonuria lead to homogenesic acid accumulation leading to the darkening of the urine on standing is what you need to remember. Very good to see 8 online classmates. Thiamine pyrophosphate is required for vitamin B1, transketolase, pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, branched chain amino acid dehydrogenase, it is required. So positively tomorrow we'll start biochemistry. 50 pages I will give you, doctor. 50 పేజీల MD biochemistry. 50 pages. This has 500 paragraphs and 2000 points. In that, at least 1000 will kill your peace. You need to repeat. And this 1000 you should be able to repeat if you sit with the friend and give him the 50 pages and chalo pooch rahe tu poocho main bolta. If you do that, hey Teja, thanks for coming. Not bad, 2, 3, 4, 2, 2, 4, 5. Pancha Pandavalu Tummeda. Our competitors are having Kaurava Sainya. In their coaching program, 1,000, 1,200 will be sitting. Our 5 Pandavas are enough to beat Kauravas anywhere. Right? Good. So, online has done all the dirty job. It made people to nicely sit on the side of the fire and stretch the leg and watch the teacher. But nothing can beat this, Dr. Conviction. I used to be very close with my father. Who is not close with their father? My father is the most inspiring person of my life. When I got seat in MBBS, I still have the postcard with me. My boy, beg, borrow, or steal and join medical college and pay 1,200 rupees fee. I cannot afford it. I went around the whole, tomorrow is the last date, I'm running around the street, somebody will borrow me 1,200 rupees. All my friends have put 100, 150, 200, like that. Finally, I came traveling in Kakatiya Express without ticket, running into the washroom every time conductor was coming, and joined. So, when my father passed away, suddenly there is no critic in my life. He is like a mock test for me. Everyday mock test. If you are done with MBBS, he says you should be joining MD General Medicine. If you are done with MD General Medicine, he says you should do DM Cardiology. So, of course, I never had chance to do that because my students all are cardiology toppers, right? There was no need for doing cardiology. MD General Medicine is like an emperor. So finally, when he died, I went to Varanasi, sitting on the bank of the Ganges, where hundreds of people will be parallelly burning their father's corpse. Then when I added the ashes into the river Ganges, then I got a peace in the heart. Yes, Daddy, I made you proud all my life, and finally, in my own hands as MD General Medicine, you passed away peacefully. So coming to a class here, face to face, is getting that conviction to the heart. You are sitting together, you're all studying together, you are fighting together. Every day we are meeting together. For you, I am studying. For me, you are studying. Once we are a cohort of those maniacs who want to achieve it, then we will get the top rank. Tomorrow, hospital is also like that. Because your another cardiology resident is there, your nurse is there, your sister Mary is there, Lily is there, and your patients love you. You don't feel to stay home anymore. You love to be in the middle of them. That you don't get in telemedicine. 2 years we practice telemedicine, the worst part of the life. Right? You need to touch, you need to hold the hand, you need to hug the patient. They need to cry in your hug. Then you are a true physician and a cardiologist, right? So, doctor, so every day get that conviction on the banks of Ganges, right? And Which fetal anomaly is more common if there is a deprivation of leafy vegetables? Leafy vegetables have folic acid. No folic acid lead to anencephaly. The normal brown-red color of the feces is turcobilinogen. Corynebacterium diphtheriae, Loeffler's serum slope. What is Robertson cooked meat medium for growing? Anaerobic organisms, right? So all these media, doctor, you need to be very much sure. EMB agar, E. coli will give a metallic sheen when you grow them on EMB agar. In the microbiology notes, I gave you almost all 12 to 15 culture media that you need to have in the mind of the foolish British guys who left this country leaving microbiology with us with Anant Narayanan, right? So we need to remember all those media names. Oncogenic viruses are Hep B, EBV, and HPV. So once more, doctor, this is another dirty list. DNA viruses, RNA viruses. He is my papa is DNA. Where is the relation between this and that? I never understood. But it's a very popular mnemonic in USMLE books. Hepatitis B, Epstein-Barr virus, pox virus, adenovirus, papillomavirus. His salary feeds me is RNA virus. Disgusting, right? So, HTLV, sarcoma, feline leukemia, and mammary tumor virus. Fungal meningitis in HIV is Cryptococcus. India ink preparation, you remember, right? Placental barrier, G for Ganga behti hai. IgG can cross the placenta. For H. pylori gastritis, what are all the things? Because H. pylori elaborates urease. It produces vacuole cytotoxin, cageate cytotoxin, are the cytotoxins which are produced by H. pylori. Remember, H. pylori is that microaerophilic organism, comma-shaped, and it can lead to maltoma, mucosa-associated lymphoid tissueoma is what we need to remember. Gas gangrene is novi septicum perfringens. You answered this correctly, right? So at least because of how many months? 2 months our journey? Ipadiki. 2 sweet months. June, July. Almost June 15th we started. In 2 months, do you think are you better, Teja? Teja was the only student I started cardiology in this class. Teja and his classmate, right? So today we have almost 20,000 students in about 60 groups, WhatsApp groups across, actively there. Purposefully at midnight, 3 o'clock also I'll post questions to see whether they will run away or not. They don't run away. That means it is useful, right? So, yeah. Our Avakai Pachadi and Garilu is floating around. I'm becoming an exhibitionist, you know. So, good. Now, our very famous competitor coaching program. क्या भाई आप लोगों को खिलाते भी क्या? हाँ, Super 30 movie, ऋतिक रोशन को याद करना. Persistent suppression of the bacterial growth is called as post-antibiotic effect. So if you give an antibiotic for a period of time, its action will remain and that lead to persistent suppression. So now in this context, doctor, you need to know 2 important things. Concentration dependent antibiotics are one group. Time dependent antibiotics. भैया ये दोनों के बीच में क्या फर्क होता है? Antibiotics which eradicate the pathogenic bacteria by achieving a high concentration at the site of binding are called concentration dependent. So, when will that kill the organisms? when these antibiotics achieve at least 10 times the minimum inhibitory concentration, then only they will be able to show their effect to kill the organisms. Aminoglycosides and fluoroquinolones belong to this group of concentration dependent antibiotics. The other are called time dependent. If they are just above the MIC, minimum inhibitory concentration, until the dosing interval, that's enough. That lead to the killing. That's called time dependent, is what you need to basically remember. So penicillins, cephalosporins, carbapenems, monobactams, clindamycin, macrolides, linezolid, they all belong to that group. On the cell wall, what acts? Imipenem, right? Now tell me, what is the very, very important indication for meropenem? Merapakailu? With the UTI, refractory UTI, meropenem very effective on E. coli. 63-year-old, severe back pain, osteoporosis. So, which vitamin is important for this? Biscuit question. Vitamin D increases the intestinal absorption of calcium. Which anti-seizure medication does an ugly job of disturbing other concomitantly administered drugs? Valproate. Because valproate has a very strong protein binding, it will displace others. And also, valproate is a inhibitor of P450. So it will inhibit the metabolism of the other anticonvulsants, is what you need to remember. Dr. Abdul Majid Pulla agreed fully with you, sir. Super. Sashi Thapa and many more who are all online. Good. Now, yesterday, I had a video call with one student from Government Medical College, Srinagar, which is just 50 kilometers away from Pakistan, right? So he said, sir, I'm a second year medical student. मुझे बहुत अच्छा लगता है आपके classes. I listen to you. I said, how much will it cost to join? Free. Knowledge is free because we enjoy being with you. I got immediate activation, all like switch on, switch off, easy, very easy, right? Is the test opening in app? Opening, right? Good, good. Huh? What?
It got stuck halfway, the test.
Is it halfway stuck?
Yes.
Maybe internet?
No.
No? I'll just check. Just we are upgrading. Even iOS version is coming in another 48 hours. Because Girija ordered.
Sir, I got an Android.
Good, no? Keep it because tomorrow when you are a busy gynecologist, no? Madam Unnaru Android low. iOS won't be, it will be given only to your anesthetist. So, which is not a prominent effect of atropine. Of course, atropine lead to dilatation of pupils. ये भी wrong करे तो अब ये जीवितमु निरर्थकमु. Now, which is androgen antagonist, doctor? Flutamide. Receptor level antagonist is flutamide. 5-alpha reductase inhibitor is 5-alpha reductase converts testosterone to dihydrotestosterone. Either you prevent the dihydrotestosterone from binding receptor or you prevent formation of dihydrotestosterone in prostate hyperplasia. What is the 5-alpha reductase inhibitor called as? Last time. Next time you should remember. Finasteride is 5-alpha reductase inhibitor. Flutamide is receptor level antagonist. Right, doctor? We finished reproductive, no? Reproductive last drugs we studied, no? అవి రుబ్బుతూనే ఉండాలి, రుబ్బకుంటే మిస్ అయిపోతాం. అన్లెస్ మిక్సీ ఆన్ करके नहीं रिवीजन करे तो all Murli Bharadwaj is not doing any special thing. You too can read if your eyes, ears, everything are working. Nothing big deal. Just I will add a little Brahmanandam effect to that. That's all. Right? And since you don't have energy, I'll show you that at 49 also I'm able to read. Why can't you read at 25? That's a simple logic. Right? Leading in the front. But you need to do revision. Tuck it here. Without confusion, go and attack the examiner. Okay? Now, doctor. Turner syndrome, biscuit question. XO. Mesothelioma versus adenocarcinoma. You did correctly? Beautiful. Calretinine. Where did we do this? Pulmonology. Huh? Good. Then, where are peptic ulcers mostly located? First part of the duodenum is the most common type of peptic ulcer. Did you answer it as gastric antrum? I know. Correct? You did that? No. First part of duodenum. NK cells express. What is the specialty of NK cells, doctor? NK cells are called ADCC, antibody dependent cell mediated cytotoxicity. Antibody dependent means they are like humoral immunity. Cell mediated means they are like lymphocytes and all that. Both the things they are capable of doing. That's the reason they are called NK cells. What are the two main key roles of NK cells, doctor? Killing the viruses and tumor surveillance. They prevent the tumor from developing. Anywhere tumor is there means NK cells will go and kill the tumorous cell. Virus protection, tumor killing is done by NK cells. That's what you need to remember. So NK cells, two important surface markers, doctor, CD markers. CD16, CD56 are the surface markers of human NK cells. Good to see 14 online classmates. Osteochondroma, I think you answered correctly. Abba. Blastoma, osteoma, osteosarcoma. Chondroma means cartilage. No? And already we discussed, no, all tumors starting with O are more common in boys. Correct. Which is diaphyseal tumor in this? Osteoid osteoma. One more diaphyseal tumor? Ewing sarcoma. Beautiful. Okay? Right. Hypoxic death in lead to coagulative except in brain, where it lead to liquefactive necrosis. Whiplash injury is commonly seen in a occupant of an automobile. In bumper fracture, tibia is fractured. You cannot reveal the identity of the rape victim by printing or publishing. Section 228A of IPC. Right? I think they also should come with one rule like this. You cannot declare the photographs of the toppers who took coaching with you. Otherwise, I went to Bhatia, I went to Maru, I went to Prep Ladder, I went everywhere. Then you mean you want all of us to pay to everyone? Right? First ranker or 100th ranker or for that matter 1000th ranker, doctor, let me tell you, nobody need coaching. They really don't take any coaching. Except 20-30% of the top 1000 rankers really go and burn 1 lakh rupees and take coaching and get within the top 1000. Let me bet it. 24 years I have been coaching students. Right? Lot of time, once upon a time in APPG entrance exam, top 10 may all 10 used to be our students. But mostly they are all mock test students. Even all mock test also, of course, they used to come to the mock test regularly. except one or two students who used to come. I mean, I'm not saying that you won't get top rank by coming regularly to Burli Bharadwaj class. But what I'm saying is, coaching really doesn't contribute directly for your getting into top 1,000. But I'll give you an exception. 30% or 20% of these 1,000 ranks are there, no? Some of the very wonderful teachers who influenced them. They're not great teachers. Who influenced them because somebody has a fear to gynops. Somebody helped them, inspired them to read gynops. Looking at some teacher also, we get interest to read that subject. Agreed? And I'm good in all 19 subjects, by the way. So I should give you the interest for reading all 19 subjects, attending with me. So that's what I like to tell you is how much you take a cue of inspiration from that buffet of live class, I mean face-to-face classes, and get inspired to consume, remember, and go and attack and reproduce in the test, right? Otherwise, section 228 ये आईपीसी कोई बोलने का बात है क्या? हम पढ़े तो नहीं समझ में आता, अंग्रेजी आए तो पढ़ सकते. What is the big deal? Hallucinatory dream-like state caused by prolonged deprivation of the sleep because of the NEETPG coaching teacher preparing whole night is called oneirophrenia. Plant penicillin, you call it as endrin. Now, exposed and non-exposed, what is that called? Attributable risk. Whereas exposed divided by non-exposed is called relative risk. That's called risk ratio. Whereas incidence of risk among exposed minus incidence of the risk among non-exposed means that is attributable risk. That's called risk difference. Okay? Risk difference, risk ratio. You need to differentiate. Relative risk. How do you calculate relative risk typically in case control trial? By calculating odds ratio. Now, a researcher wants to prove a relation between COPD and smoking. He collected record from the government hospital and record of the cigarette sale from the finance tax department. This is an example of ecological study. That means in ecological study, it is not the person who is the unit, but a population which is the unit is what you need to remember. If you want to formulate a hypothesis, ecological study is good. Then, doctor, prospective screening versus prescriptive screening. So what is the difference between the two? If you screen people for their own benefit, it's called prescriptive. People screen for others' benefit is called prospective. Agreed? For example, a person who has got a contaminatable disease and get into the swimming pool, you do screening for that, that's called prospective. But a person jumping into swimming pool tested for seizures, that is for his own benefit. That is called prescriptive. Prescriptive is for case detection, prospective for disease control. Like COVID screening. In the initial days, every home, tuck, tuck, tuck. I'm the police officer. Come on, come out and let me check your COVID status because your maid told everybody that you have fever. Right? So we stopped maids also because they are distributing the news that सार की हॉस्पिटल जाता है डॉक्टर साहब उनके उसको बहुत बुखार है. Then the whole street is afraid to come into that street. People were asked, to empty the house and go. We are bloody useless beggars called doctors, right? We serve the people and people are, if we get fever because we have COVID, they are asking us to get out is nonsense, right? So request for screening, no specific request. prescriptive. Specific request from authority. Come on, all that red light not, what is that? Red colored COVID area, let it be checked for. So neonatal screening, cancer screening, urine for sugar, that is all what? Prescriptive screening. Median is 200, standard deviation 20, 68% will fall between this. One of the biscuit questions that you need to. Doctor, there are totally 200 high yield facts in biostatistics. We will take about 10 hours. I will make you champion, and 2 dirty questions come in entrance, but 2 will matter a lot. The other day I told you, no? Girija, you getting top rank is earning 1 crore for daddy. 1 crore in 200 marks. Each question is 50,000 rupees preparation. When you get seat, you are going to, we have a different deal, no fees. 10% of the private seat value will be sent to my account. So 68% is what, doctor? 1 standard deviation. So 1 standard deviation is 200 minus 20, 200 plus 20, which is 180 to 220. So this rule, 100% will fall into 99.7. Then 95% range, 2 standard deviations. 68%, 1 standard deviation. The variation of the data is compared with another data. Stroke ratio in strokes in Hyderabad are compared with strokes in Mumbai. So there is a variation in this data compared with another data. Then you need to calculate coefficient of variation. So it is a measure of dispersion of the data. Coefficient of it is a relative measure. Whereas standard deviation jo hota hai, it is an absolute measure of dispersion. So what is standard data saying? There is one median value, mean value. How far a data point is away from the mean value is told by standard deviation. Whereas this measures the ratio of the standard deviation to the mean, will give you coefficient of variation. Okay? Beyond it, don't learn about it. Not good for health. Coefficient of variation formula to batti maro. Standard deviation divided by mean into 100 will give you coefficient of variation. If one variable is given, then you can find another variable by using the coefficient of regression. So in the score app, we do what is called as final score predictor. Based upon how many marks you are getting now is correlated with what possible rank you will get in NEETPG. Do we need to do that? We ourselves know. Simple rule, doctor. Out of 200, you are able to get 160 in Murli Bharadwaj grand test. You can take a break from preparation, go for a sleep and enjoy a holiday, and then go to the exam. Reach a point that your score is more than 160. Acha, usme score aa rahe kya after every 5 questions score? It will keep on telling you. Actual exam that it doesn't tell. Don't get addicted to that. So in the score app, when you are playing, no, every 5 questions is over, it keep telling you. भाई anatomy हो गया, इतना राइट्स है, रॉन्ग्स है, स्किप्ड है, तेरा नेगेटिव स्कोरिंग ऐड करे तो कितना है, तेरा स्कोर खत्म. So shortly, as many people are taking the test, we will also tell the best guy answered 5 out of 5 correctly. You are a stupid guy who answered only 1 out of 5 correctly. That is cruel, right? So coefficient of regression. So you have done a study to assess the malnutrition among children. 100 children are selected from both rural and urban. Out of these, 30 among rural, 20 among urban were found to be malnourished. What statistical test will you do? Okay. थोड़ा हम 2 minute लंबी चर्चा लेंगे. भैया variables होता है discrete variable, continuous variable. What is the meaning of discrete variable? If the answer is yes or no, darling, do you love me? No. It can't be like, I'll try. Depending on your NEETPG rank, I will try to love you. होता क्या? No. Yes or no? Right? Are you pregnant? Yes or no? Can't be slightly pregnant, you can't say, right? Then what is continuous? What is your weight? I can be 30, I can be 40, I can be 100, anything I can be. I can't say I am zero weight and you have weight and I have no weight. वैसा नहीं है वो. So height, weight, color, these are all examples of what? Continuous variables. These are what? Yes or no type. Smoker, no smoker. Drinker, no drinker. Have 10 girlfriends or only one wife. It's a standard measurement. So now the question is, whenever you have yes or no type of discrete variables, if you compare the population of Usmania Medical College with Gandhi Medical College, right? How many guys don't have girlfriends in Usmania Medical College, let us say? Let us say out of 250, 200 are girls and 50 are boys. That's okay. Each boy has a chance of getting at least 4 girls. In his batch, 4 in senior batch, 4 in junior batch, totally 12 possibilities are there. So high chance of having hooked to somebody or other. Opposite only arts college is there, full girls. Right? Whereas Gandhi Medical College is somewhere, वहाँ क्या है वो? Padura Nagar. There is a chance. Other medical college girls will come and join in internship. That is the main reason why everyone chooses going to GMC for internship. I'm just waiting who will give me internship. So GMC. All right. So you found that 30% of boys are already booked and immunized in medical college. They already have a girlfriend. And here, 70% of the boys are already booked and immunized. Hooked and immunized. Right? So you are comparing what? Proportion here with the proportion here. When will you do that? If it is a discrete variable where answer is yes or no. So if you want to compare the proportions, you use the chi-square. Right? Whereas here, in Gandhi Medical College, 60 out of 100 have a weight of 110 kgs. And 40 have 40 kgs. So here you get all their weight added and you get a mean value here. And Usmania Medical College also you did mean value. Mean value here to mean value there you are comparing if it is a continuous variable. And there you use the t-test. So once more summarize, doctor. Discrete variable where answer is yes or no, you are comparing proportions and there we use the chi-square and calculate the odds ratio. Whereas continuous variable where you are comparing the mean values and then you use the student t-test, right, is what you need to remember. Then what is meant by paired t-test? Once more it is used for continuous variable. So 100 people before receiving insulin, after receiving insulin, their mean glucose values you are comparing. Once more you are comparing mean with mean only, before and after the intervention. That's called paired t-test. Otherwise it is called student t-test. If you are comparing Usmania Gandhi mean weights. Got this much? बाद में देख लेंगे biostatistics में. So chi-square test is comparison of categorical value, otherwise called discrete value. Yes or no? Boy or girl? T-test is comparison of categorical and continuous, where mean value is calculated. Correlation is relationship between only continuous, that's values, right? Only heights of this population with heights of that heights of this population with the IQ. Taller people have higher IQ, or lower people have, shorter people have higher IQ, you want to know. So you are correlating only what IQ like continuous values. So correlation is only done for continuous variables when means are correlated. Means you are doing means t-test, but yes or no and proportions means it is chi-square test. समझ में आ गया? Now what are the indicators of air pollution, doctor? Sulfur dioxide, smoke, and suspended particles is what you need to remember. Good to see SR and many more who are all online. This is a tricky question, tricky question. Maximum work hours of a person including overtime. నాకు తెలుసు కొట్టింది Doctor, 48 hours is regular work, 12 hours is overtime. Putting together 60 hours is including overtime. Agreed? So the total number of hours of work in any day shall not exceed 10 hours. Unless you waste 90,000 rupees and go to a coaching center, they will make you to exceed 10 hours. It is against the Factory Act. Then the spread over inclusive of intervals of rest, breaks we take, is 12 hours in any one day. Maximum. Except doctors, we do bloody 36-hour night duty. 36 hours is waiting for you when you join Usmania. Starts with morning 8 a.m. Next day night 8 p.m. You did that? Good, very good. But internship तो मजा है, एक saline लगाते, उससे ज़्यादा क्या करते? ज़्यादा सा time line मारने में ही चले जाता. So 12 hours of line marna is permitted. The total number of works in a day, hours of work in a week, including overtime, shall not exceed 60. And the total amount of the hours of the overtime work will not exceed 50 hours for any one quarter. Quarter means 3 months. ये तो लाइट ले लो, ऊपर का याद रखो. So these are all important, doctor. Tomorrow, Girija, in your multi-speciality corporate obstetrics gynecology, birth of the baby center, your nurses, everybody, their PF, ESI, insurance, Factory Act recommendations, so many things. Don't worry, appoint me as your hospital manager. I'll take care. You earn money, you cut, I cut money. So extended sickness benefit for TB, 2 years. Which is not a postcoital contraceptive. Estrogen RU486, copper T200 also you can put if you had an accidental intercourse and don't want the baby until NEETPG counseling is over. Right? So danazole is not. Then what is this, doctor? Equality rights of women, female condom. Women also have a choice to decide whether to let the stupid sperm to come inside or not. So now comes general medicine. Not bad, 50 questions in 50 minutes. Very good, doctor. 16 online classmates. I am very much happy. Thanks for joining the session. So once upon a time, we used to not have all these partitions. 160 students used to sit packed in the classroom, right? I should have a little small space to stand and deliver a grand test discussion. But that is also a fun, when you have a lot of people. Now, doctor, 42-year-old man, genital sore, non-tender bilateral inguinal lymphadenopathy, and typically the lesion which you are seeing is chancre, syphilitic chancre. Syphilitic chancre is painless, doctor. So this guy continue to, because it is painless means he will continue his underground work of digging. So there is nothing that stops him when it is painless, right? So there is one question on STD compulsory, doctor. And what happens? Syphilis become tertiary syphilis? Aortic aneurysm. You answered correctly? Correctly? Good, very good. 67-year-old, acute shortness of breath and lower extremity edema, inspiratory crackles in the lung base, lower extremity edema is 3+, and he has got a difficulty to get on to even the moving in the apartment, right? So what is, you are able to see elevated JVP, presence of pedal edema, pulsating liver, peripheral edema. These are all the signs of right heart failure. Pulmonary edema is a feature of left heart failure. So the best way to look for is in echocardiography. Agreed? Now tell me, I'll ask you this question. If you answer correctly, no. Girija, tomorrow I'll bring ullipai pakodi, onion pakodis, along with hot steaming tea in the flask, right? So somebody asked me, how will you manage? You give free coaching to a lot of students, whomever you like our Mr. Reddy. What is your name? Tejishwar Reddy. Tejishwar Reddy. Or some student in Kashmir. I say, what will I do with so much money? Every day almost all 8 to 10 students pay 15K, and we make about 1.5 lakh in a month, about 40-45 lakhs. Baith ke. Still, a lot of students don't pay also, is okay. But we get an opportunity to sit and eat pakodis with Teja and Girija and Sushant, have a cup of tea. Who will have this kind of royal thing, unlike other teachers who are flying from Delhi to Bombay to this thing and facing Kauravas? We face Pandavas in the class and teach to Kauravas everywhere, right? So a lot of times what happens, doctor, tomorrow when you are in practice, remember, never look the patient as a opportunity to buy a new version of Mercedes Benz. Benz follows you, provided you take care of, if you take care of Ganji, Benji will follow you, right? So if you take care of Ganji, your Lachaka, Butchava, don't stop them just because they did not pay the initial deposit money. Cruel. What I'm telling you is, MD is not about knowledge. Already you have knowledge. You know what is fibroma, what is breast carcinoma, what is colposcopic biopsy, blah, 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 everything. What is there to teach in MD? MD is all about that empathy, doctor, empathy. Love for the patient. The moment you hold the patient and say, Em Annapurnama garu bagunnara, etla untunnaru, tintunnara, leda. Oh, Annapurnama will be happy. End of the day, you get a stomach full of content, doctor. That content is everything that we live for and die, right? So, echocardiography you need to do. Ejection fraction. Now my question to you is, Adi, man asal question. Tension la wait chestunna. Em question adugutadu vidari. Igo. Heart, pulmonary artery, there is an embolism. You have done 2D echo. What is that parameter that tells you that there is a pulmonary embolism and significant acute pulmonary hypertension? Pulmonary capillary wedge pressure talks about left atrial pressure. Pulmonary capillary wedge pressure. And do you do that in 2D code? No. You have to do angio to find it. You need to pass a catheter from right atrium to right ventricle to pulmonary artery to pulmonary capillary and get the pulmonary capillary wedge pressure to get the left atrial pressure. What is that pressure? We grade pulmonary arterial hypertension to mild, moderate, severe based on the value of that in the right ventricle. Come on. Come on, Teja. RVSP. You don't remember? Right ventricular systolic pressure. If it is less than 40, it is 40 millimeters mercury. It is mild. 40 to 60 millimeters mercury of right ventricular systolic pressure, pulmonary hypertension is considered to be moderate. More than 60 means pulmonary hypertension is severe. Because if pulmonary arterial hypertension is there, right ventricle to push the blood into the pulmonary artery, it needs to use a lot of pressure. And that pressure is called RVSP, right ventricular systolic pressure. Right? Which you can gauge by doing the 2D echo is what you need to remember. All right, doctor? No worries, no worries. Malla sir cardiology, neurology chadavali beta. Lekune malla modalu pedtanu nenu. Anyway, we need to read cardiology, neurology in the basic sciences. Once more the same JVP, BVP, heart, first heart, second heart. At least now tell me. Diastole is between which sound to which sound? Systole is between which sound to which sound? After S1 is systole, S1 to S2 is systole lub, systole dub, diastole. Good. Not bad. 80-year-old, coronary artery disease, myocardial infarction, 5 days ago, BP 80/60, echocardiography is showing apical kinesis. And what do you see in the 2D echo, doctor? 2D echo, what are you seeing in the ECG? ST segmented elevated, ST segment elevation. Where is that? V2, V3, V4. V2, V3, V4 is called septal leads. V5, V6 are lateral leads. V1 is right-sided lead. Remember, right? Where will you find a prominent R wave? In V1 or V6? V6. If it doesn't progress to a prominent R wave, that is called poor R wave progression, which is the sign of ischemic heart disease. Generally, in the lead V1, you don't find any prominent R wave. R is the positive wave, Q is the negative before the positive wave, and S is the negative after the positive R wave. Generally, you don't find R wave in lead V1. But if you find significant R wave in the lead V1, what does it indicate? It is a inverse change. What is the reverse of R wave? Reverse of R wave is S wave. Reverse of R wave is S wave. So in the posterior part of the heart, if there is any myocardial infarction, appearance of Q wave is one of the sign of infarct. Right? Since you don't have a lead posteriorly, in this anterior V1 lead, reverse of that Q, which is R, will appear. So if there is a R wave in the lead V1, think of posterior wall infarction is what you need to remember. So this is one of the complications of the MI, which is called free wall rupture. Typically, the free wall rupture, 5 to 10 days after the MI, peak 7 days after. If you are a patient of MI that started 1 week ago, suddenly go into a shock. Think of the possibility of myocardial rupture because your infarction has weakened the wall, right? And that got ruptured. One of the complications of MI. We discussed this, right? Sir, no problem. Then what is another complication? There can be development of an aneurysm of the ventricular wall after MI, another complication. How do you identify aneurysm of the ventricular wall? If there is persistent ST segment elevation in multiple leads, You will suspect possibility of MI. See, once you got MI, no, ST segment elevation will occur, but it will resolve. But if there is a persistent ST segment elevation, that is one of the indications of development of a aneurysm. Is what you need to remember. Quickly tell what are the 5 drugs you will give when your patient of MI is discharging. Yesterday we discussed. Fatafat bolo. Okay, A for aspirin, goli, dalo. Next. Which beta blocker? Metoprolol. Metoprolol. Right? Then yesterday we have seen carvedilol, metoprolol, bisoprolol. Right? Which is that which is having which beta blocker is having this? If you don't answer, I'll be very sad. Every time I'm threatening, don't worry. Beta blocker. ఇంటికి పోగానే చదవాలి బిడ్డ, చదవకుంటే మురళీ భరద్వాజ్ చదువు వస్తుంది, మురళీ భరద్వాజ్ చదువు వస్తుంది. టీచర్ పండితుడు అవుతాడు కానీ శిష్యుడు కూడా కావాలి పండితుడు. బీటా బ్లాకర్, నాట్ ఓన్లీ బీటా బ్లాకింగ్ యాక్షన్, it also has an action on the beta 3 receptor, so it will cause the nitrous oxide and lead to vasodilatation, which is an advantage which it is having. Not P, N. Nebivolol also is having a beta 3 action other than regular beta blocker. So it causes the NO release and it acts like a vasodilator, which is good and preferable. Right? No problem. 62-year-old. 62-year-old recently started on a medication for high BP. His hypertension is in good control, but he is feeling strange since he started the medication. There is a feeling of chest tightness past 3 weeks. He also noted pain in elbow and knees. And typically he developed a lesion of the skin. They are all lupus-like lesions. What are the causes of drug-induced lupus? Procainamide, procainamide, hydralazine, super. Unda adi hydralazine? There, finish. You correctly answered? No. Ayyo. To not study and to not get seat is okay. Studied but not getting seat doesn't happen actually, unless you borrowed brain to devil, right? Revision. Why did you then not answer? Idiopathic reasons, sir. Primary NEETPG failure it is called. Secondary NEETPG, primary NEETPG failure will be there. One is idiopathic, other is secondary causes. Acha, Wernicke encephalopathy, vitamin B1 deficiency, So, 23-year-old, while coming to the office party, she is punched on the side of the head and stabbed in the left flank. Her speech is slow, bad headache, 70/50. You have given ringer lactate. What is the next best step? Exploratory laparotomy. You need to jump and do. 52-year-old, emergency, crushing substernal pain. And you have given Mona. What is Mona? Morphine, oxygen, nitrate, aspirin, Mona are given, but they did not relieve the pain. 23 minutes, duration of symptoms. What is the next treatment? ST segment elevation is there, means indication for thrombolysis. TPA, right? మళ్ళీ థ్రాంబోలైటిక్లని గట్టి చదవాలి. స్ట్రెప్టోకినేస్ ఏడ పనిచేస్తుంది. వాట్ ఈస్ ఎప్సిలాన్ ఎమైనో క్యాప్రోయిక్ యాసిడ్? యూ రిమెంబర్? It is anti-fibrinolytic. It is inhibiting the lysis of fibrin. That means it is promoting fibrin to remain fibrin and forms the clot. and prevents bleeding. So we use epsilon amino caproic acid as a antifibrinolytic if somebody is having excessive bleeding because of your thrombolytics. Thrombolytics break clot fibrin. This will prevent breaking of the fibrin. Okay. 74-year-old comes with giddiness, 74/50, respiratory rate 12 per minute. Her capillary refill time is only 5 seconds. What is that you are seeing here? Right? Giddiness, capillary refill is 5 seconds. Are you seeing anything here? What is the heart rate? How do you calculate heart rate? Between one R wave, another R wave. Any double in it? Pedda double. Between one R wave, another R wave. 1, 2, 3, 4, 5, 10. 1, 2, 3, 4, 5, 6, 7. So 300 divided by 7 is equal to almost 45, 42. So significant bradycardia is there. So whenever sinus bradycardia is there, patient is symptomatic because he is having giddiness and all, time to administer atropine. That is an indication to administer atropine. And what is the very common cause of this kind of bradycardias, doctor? You are in the OP, in the casualty. MI, inferior wall MI can lead to bradycardia. Very good point. Inferior wall MI, inferior wall MI is also there. You can see 2, 3 AVF. Lead 2, ST segment elevation is there. 3, here also you can see the ST segment elevation. AVF also you can see. Good. Inferior wall MI with symptomatic bradycardia is an indication for atropine. With atropine, if this bradycardia doesn't revert, what is the next step? Pacemaker. TPI. Temporary pacemaker insertion is considered to be the management. 82-year-old with severe abdominal pain with anorexia, nausea, vomiting. And he also has a blurred vision. And he is taking metoprolol, digoxin, hydrochlorothiazide. And what do you see here, doctor? See, always remember, in real exam, if digoxin is there in the story, one ECG is shown, means what examiner trying? Digoxin toxicity in the ECG. There's nothing more. So answer should be digoxin toxicity. Simple. అది ఏంది మళ్ళా ఇందులో డయాగ్నోసిస్ ఏంది ఇది పెరాక్సిస్మల్ ఏట్రియల్ టెకికార్డియానా గదెట్లుంటది ఆల్ దిస్ ఈజ్ నాట్ రిక్వైర్డ్ రైట్ సో atrial tachycardia with high grade second degree AV block. Second degree AV block. Second degree AV block is how many types? Mobitz type 1 and type 2. Where do you see Wenckebach phenomena? 1 P wave QRS, then P wave with a little delay and then QRS, then P wave further delay QRS, then P wave no QRS, and it continues, right? Whereas P wave QRS, P wave and QRS normal, P wave and QRS normal, P wave and QRS, everything going normal. Suddenly QRS dropped. That is Mobitz type 2, which is an indication for pacemaker. Gopi, Gopika are going to reading room together. Gopi, Gopika. Gopika stopped responding on the WhatsApp. After that, she removed his profile, blocked. By this time, Gopi should understand Gopika no more is his Some stupid fellow who finished USMLE 99 percentile score brought by her father. Then what will Gopi will do immediately? Wash face. Aishwarya vachindi, right? Mallama street loki Aishwarya vachindi. He'll fall in with the next Aishwarya who is there available, who probably is Gopika's good friend. So here no sudden heart collapse will occur. No need of pacemaker. Whereas Gopi, Gopika going together everywhere, kissing each other, reading same line in the USMLE book. Suddenly Gopika disappeared and gave a wedding card. What happened to Gopi? Dilated heart failure. So that is a sudden drop is dangerous. No time for discovering Aishwarya. So that's a problem, right? So this is what Dr. Mobitz, it's a second degree heart block with paroxysmal atrial tachycardia, which is seen in digoxin toxicity. All right. Now, 43-year-old from Kanpur with palpitations, intolerance, nervousness, insomnia, fine tremor, diffuse non-pitting edema in the anterior lower leg. What do you see in her, doctor? Upper part of the sclera is also visible. Right? So there is a sign called Stellwalk sign. So this is a case of typical proptosis that you see with Graves' disease, which is hyperthyroidism. And what are the important serological marker of Graves, doctor? Anti-thyroid stimulating hormone receptor antibodies. That is called TSAPs. Thyroid stimulating antibodies are typically positive in Graves. 18-year-old with primary amenorrhea. And some cousins are colorblind. She is in distress, very minimal breast development. That means she did not produce significant amount of estrogen, which is required for the development of the breast. Vagina is there without rugae and a cervix that is easily visualized. Urine test negative for beta-HCG. That means it is not pregnancy. Agreed? So what is this condition? This is called Kalaman syndrome, where hypothalamus is failing to produce the gonadotropin releasing hormone, leading to the primary amenorrhea. And if your gonadotropin releasing hormone is not there, FSH is not there. If the FSH is not there, nobody to stimulate the ovary to produce follicles. If follicles are not stimulated, no estrogen is produced. If there is no estrogen, there is no breast development. Everything because of that bloody stupid hypothalamic dysfunction, which is called Kalaman syndrome, is what you need to remember. They'll also have anosmia. Color blindness will be there in the relatives. It is autosomal recessive inheritance pattern. Now, 32-year-old, increasing thirst, urinary frequency, nocturia. So whenever there is any polyuria, you will think of diabetes insipidus. Now the question is it a central diabetes insipidus where ADH is not produced, or is it a nephrogenic diabetes insipidus where ADH receptors are not responding? How will you know that? Always remember, in endocrinology, rule is simple. If there is any excess hormone situation, what will you do? You do a suppression test. See whether suppression is able to stop the excess hormone or not. If there is any low hormone condition, you do stimulation test. With stimulation, at least hormone increased or not. There are the two types of tests. What are the two types of tests? Stimulation test, suppression test. Where do you do suppression test? Hyper conditions. Like Cushing's is a hyper. There you do suppression. Whereas Edison is hypo. There you do stimulation test. Diabetes insipidus is hypo. ADH production is decreased. There you will do stimulation test. So what will you stimulate? How is ADH production normally stimulated? If your osmolarity of the plasma is high, If you are dehydrated, osmolarity increases. Increased osmolarity stimulates your pituitary to produce ADH. So if you want to do ADH stimulation, what you need to do, you deprive the person from consuming fluid. Then his plasma volume shrinks. His osmolarity increases. That is supposed to go and stimulate the ADH production. Agreed? So a fluid deprivation test was done. Right? If the fluid deprivation, okay, I think I'm going too fast. I'll go slowly for you. Understand? Pakka? I can recognize easily. 2 lakhs Girijas I have seen. I know whether it's registering or not registering. You are just waving the head for waving sake. That movie is there, no? Nambi Narayana. Will you agree? He will say like this. So this is said for no in French. So don't say this. Huh? So this is pituitary. Huh. This is pituitary. Okay, beta. Kidney. Okay. ADH comes and acts. It lead to H2O retention into plasma. So that urine may H2O will be not there. If H2O is retained by antidiuretic hormone, in the urine H2O will not be there, water will not be there. Then if ADH is produced, what happens to the urinary concentration? Huh? Increase or decrease? Concentration increases. Concentrated urine, because there is no water, because all water is reabsorbed. And urinary and plasma osmolarity become diluted. That means plasma osmolarity will decrease if the ADH is produced. Now let us talk about a person who has a diabetes insipidus. His ADH is not produced. Because of that, how will be the urinary osmolarity? All water enters into the urine and urine become dilute. If ADH is not there in diabetes insipidus, so it will decrease. Plasma osmolarity will be high. Agree? Now what is this basically? Diabetes insipidus, which is a deficiency condition. In all deficiency conditions, what will you do? You will do stimulating test. Stimulating test. So what you will do? You will do fluid deprive a person. So by fluid depriving him, what are you doing? You are creating a low plasma volume further and increase his plasma osmolarity. This is supposed to go and stimulate the ADH, and that ADH is supposed to come if pituitary is working, right? ADH is supposed to come and correct the situation, right? So in spite of increasing the fluid depriving and plasma osmolarity is made to get increased by fluid deprivation, in spite of that, if the urine osmolarity, which is low, is not corrected, that means what? Either ADH is not getting produced or ADH is kidney is not responding. That's a proof. Correct or not? అర్థం కాలే కదా అయిందా పక్కా సుశాంత్ కలెక్టర్ సాబ్ సమझ में आए what are you expecting? It's like this, doctor. Girija did not study anything in MBBS. Chumma. చదువుకున్నాం ఓకే అనుకుందాం. She did not study anything. So before I say that Girija, I am the authority who is a messiah born in the world, I am the God and make you to get seat. First I need to make Girija feel that, sir, you are the Himalaya of knowledge and I am the Andaman Nicobar Island in... First I need to prove, no? So what will I do? I'll ask 5 questions to Girija. I'll do fluid deprivation. I will stimulate whether answer will come. Impossible, sir. Even if you ask me 100 questions also, answer is not going to come. So first, what did you prove by doing stimulation test? There is a deficiency. Then what will you do? Okay, Girija, you are not answering the questions because of two reasons. Either your brain did not read in MBBS, or you don't have brain. Only two possibilities. Okay, you are very sportive, Girija. Any other girl would have come and slapped me by now. क्या रे क्या फालतू बातें कर रहे रे तू? So, second, what I did, Monday to Saturday, I taught her all the NEETPG high yield facts and then conducted a test on Sunday. That means I replenished ADH injection and once more try to do the fluid deprivation test. Fatafat, she is answering. That means there is a brain, but correct teacher was not there, correct high yield facts were not there. In spite of teaching Monday to Saturday, on Sunday, if the test is conducted, still Girija is not answering hydralazine as the cause of the SLE, you answered. That too you correctly answered. Lupus. Okay, no problem. That means problem is, next step is, next investigation of choice is MRI brain. But brain is there physically. Inside the brain, there is an area where memory goes. That is called limbic system. Neurosurgical intervention needed. Right? So, that's the story. You understood? Quickly tell me, Dr. Kulsum Muhammad, what happens in diabetes insipidus? ADH is not, they're either not produced or not acting. That's the reason water is not getting reabsorbed. So it is entering the urine. So urine is diluted. That means urine osmolarity is low, plasma osmolarity is high. You have done a fluid deprivation. In spite of that, if it is not improving, that means ADH is neither, you have proven first. That is called fluid deprivation test. Okay, doctor. So what did he do? First fluid deprivation test, it did not increase any urine osmolarity. That means proved. Now he has given desmopressin, Monday to Saturday classes, and urine osmolarity improved. That means the problem is, production is problem. In spite of giving desmopressin, if the urine osmolarity is not improving, nephrogenic diabetes insipidus. Okay? Anyway, once more, we are going to have it in the endocrinology division. Endocrinology, the basic sciences, too much. Innocent people. We are torturing, right? But cardiology, why you should do wrong? We finished cardiology, right? Very good. Megha is asking a question. Sir, will class recording will be available later? No way. You have to pay the fee, Megha. 15,000. I will send you the account number. All videos will be available. I will also be available. You asked me to come to tell the home tuition also. I will give tuition. Huh? So, yeah. 53-year-old woman presents to the clinic with complaint of headache, blurred vision. And her family says her appearance looks different. Maybe you got the photo? She was a Kodalu, now she became Attagaru. सास भी एक दिन बहू थी. अभी काम करना बंद कर दिया, ऐसा बन गया. जब काम कर रहे थे ऐसा है, वैसा कुछ भी नहीं है. It was only 5 years back. Suddenly she got a different, had spacing between the teeth increased. What is this called? Acromegaly. Acromegaly. Acromegaly is typically after your ossification centers fused. If you happen to have excess growth hormone, you develop acromegaly. Before that, you will become gigantic. Agreed, doctor? So, question is, what is the increased risk of malignancy in the people who have acromegaly? Typically, they have colon carcinomas are more common in the people who have acromegaly. 13-year-old, increasing body hair, 17 alpha hydroxylase deficiency. అబ్బా ఇదో పెద్ద స్టోరీ ఉంటుంది. 21 alpha hydroxylase, 17 alpha hydroxylase, 11 alpha hydroxylase. This is called congenital adrenal hyperplasia. Endocrinology. मजे में पढ़ाई करेंगे. अभी तो quickly I'll finish this. But that is injustice to this beautiful topic called CAH. My favorite, one of the favorite topics. Barter, Liddle's, renal tubular acidosis, congenital hyperplasia. I love to teach. No one knows in the world. You know that? I'm the father of teaching all these things. That's called self-proclaimed Baba. Huh? So, doctor, congenital hyperplasia, why does it happen? Fundamentally, corticosteroids, mineralocorticoids, and androgens, testosterone. For all these three, Parampita, Paramatma, original molecule is same. From that, they become broken down depending upon which enzyme is working. From the main molecule, all the three will form. Corticosteroids, mineralocorticoid. Mineralocorticoid means aldosterone. And androgens, testosterone. For all of them, the main base is same. So whenever there is any enzyme deficiency, one of these steroid or mineralocorticoid or androgen is deficient. Suppose if steroid side enzyme is not working, then suddenly it will, precursor will cause more mineralocorticoid production like that. So whenever these things are not produced, immediately whenever deficiency of steroid is there, who will be stimulated? Corticosteroid is not there, then ACTH becomes stimulated. That high ACTH will come and stimulate the adrenal to become bigger. That's the reason congenitally their adrenal is hyperplastic because of deficiency of one of the products produced by the adrenal, and the deficiency stimulated the ACTH, and that high ACTH led to the enlargement. So how do you need to treat it? Simple. You need to give steroid, replenish it. That is the treatment. If mineralocorticoid is not there, replenish it. If testosterone is not there, replenish it. That is the treatment. So now the question comes, between 11 alpha hydroxylase, 17 alpha hydroxylase, 21 alpha hydroxylase, where is androgen not there? Where is steroid not there? Where is mineralocorticoid not there? Where other hormones are high? अगले हफ्ते हम हमारे रेगुलर क्लास में खेलते खेलते पढ़ेंगे. No tension, right? But I mean, this is an introduction. When we start the topic, no Girija, in the regular class, అమ్మో ఇంకొక కొత్త స్టోరీ మొదలు పెట్టిండు వీడు అనుకోకుండా. Sunday grand test it came and I did not answer. So it's important. Everything I tell important only, doctor. Nothing I'll tell trash, let me tell you. 54,000 points are like 54 gems, pearls that you are collecting on the underneath of the seabed. Remember that. And what all other teachers teach is crap. No. Cut the statement. They also teach good. But the point is, they teach for their own learning and understanding. I teach for your learning and understanding. If you don't understand, if your face is not looking that you understood, I don't progress forward. I stop myself and then come back until you understand. Okay? So that's the reason I'm the bad student, but a good teacher. 72-year-old, bradycardia, cool and puffy with dry, coarse skin. That means hypothyroidism. And why is it started? Because his ECG showed this. What is there in the ECG? What is there in the ECG? QRS is not preceded by P wave. This is the QRS T wave. QRS T wave. Where is the P wave before QRS? It is not there. Right? That means absence of P wave is atrial fibrillation. For atrial fibrillation, some drug is started, and that some drug led to hypothyroidism. What is that drug? Very good. And what are all the side effects of amiodarone, Bolo? Cornea. It lead to verticillate cornea keratopathy. Verticillate keratopathy. I even put one image and voice in the WhatsApp group also. And a slate-like pigmentation of the skin is produced by amiodarone. Very dirty drug, amiodarone. It does a lot of bad things. It leads to both hypo and also hyper. Both thyroidisms are caused by amiodarone. Right? So the list already we discussed in the drugs somewhere. Amiodarone side effects 5 or 6 in the gale. Leftover pharmacology may adverse drug reaction is there. There we discuss. I'll come to that tomorrow class. Okay. Now 48-year-old chronic alcohol user, 3 days of nausea and severe diarrhea, and she is receiving IV hydration, dextrose. Then there is a carpal spasm and facial twitching on percussion of the facial nerve, Chopstick sign, Proteus sign. They're all signs of hypocalcemia. And what is ECG showing? What is ECG showing? ECG is showing the signs of hypomagnesemia where the QT is prolonged beyond 510 milliseconds. From the beginning of the Q wave to the end of the T wave. How do you calculate QTC? From the beginning of the Q wave to the end of the T wave. If it is more than 400 milliseconds, you call it as prolonged. Each small box is 40 milliseconds, doctor. More than 10 chinna dabbalu, more than 10 small boxes, then it is prolonged QTC, which is a sign of and also hypomagnesemia. Same features of Chopstick sign. If you tap on the facial nerve, there is a what? Spasm of the facial muscle. Then if you increase the BP cuff, then that goes into tetany. All these signs of hypocalcemia will also appear with hypomagnesemia. Hypomagnesemia is very common in the people who are on parenteral nutrition. What do you mean by parenteral nutrition? Ante kada. Parent is feeding and that's called parenteral. Don't tell me. Now 32-year-old comes to gynecologist. She and her husband only, not other's husband, trying to conceive for 15 months. And her menses are irregular. She wants to be pregnant. She went to ophthalmologist. What is ophthalmologist discovery? He did a perimetry and found bitemporal hemianopia. How will you correlate this bitemporal hemianopia, Teja, with her infertility? Infertility is due to anovulation. Anovulation is due to hyperprolactinemia. Hyperprolactinemia is due to prolactinoma. Prolactinoma is a anterior pituitary mass lesion. Anterior pituitary mass, when it is growing, it leads to the optic chiasma compression. And that lead to bitemporal hemianopia. In the another story. ఏంలా ఇవి ఒక్కసారి ప్రాక్టీస్ చేస్తే standard, doctor. All this is very standard. Why prolactinomas are detected very early in men, women than in men, you know? Anovulation, amenorrhea, they took gynecologist. Gynecologist will ask standard protocol. Whenever you have anovulation infertility, every gynecologist, at least if they took Dr. Murli Bharadwaj coaching, will ask to go and check the prolactin level. And prolactin level is high means they will send to ophthalmologist because her husband is ophthalmologist without practice, no. And he is living on his money, blood. She does cesarean and he takes 50% and takes her out to Taj Krishna for dinner. My money. How can that happen? Come on. You have high prolactin, go to my hubby. Next door. It won't be this much air conditioned big hospital. He's practicing. All right, go. And he'll be looking into the one size to the other size. And this prolactinoma patient came. He did. Then he found bitemporal hemianopia. Honey, bitemporal hemianopia is there for this patient, honey. Huh? What are you doing? Oh, man. Cha. Did you tell her? Yeah, I told already because I'm very ethical, unlike you bloody gynecologist who is unethical. Then she says, okay. She'll call she'll say, I thought it won't be any pituitary prolactinoma. If it is not prolactinoma, I thought of putting her for IVF and then 2 lakhs will come and हमारा बेटा इंग्लिश मीडियम जाएगा हमको बहुत ख्वाब है पूरा ख्वाब समुंदर में डूब गए हैं because you found bitemporal hemianopia and prolactinoma. It's all right. Then she will call her classmate. Husband is a poor fellow. He did not get a proper NEETPG seat and took ophthalmology. Then that hot, handsome hunk, Vijay, how are you, man? Oh, no, is it? You took a new Mercedes? How is your neurosurgery practice going on? Very good. By the way, I have one prolactinoma. Will you do a pituitary adenoma resection? Very good. 50-50. Very good. Then she will call her honey. No worries, honey. Our bacha going to English medium school is still there because Vijay is going to sign 50% cut. Right? At least will you remember this? Itna drama karne ke baad bhi. Good. So, doctor, that is the problem of prolactinoma, which is causing anovulation. So, why high prolactin will lead to? So, you should remember this very important, doctor. High prolactin will cause inhibition of FSH production. If there is no FSH, follicle doesn't grow. If the follicle doesn't grow, it doesn't ovulate and form a Graafian follicle. So that's the reason an ovulation is there. So how do you treat? Treat the prolactinoma, high prolactin. So what is the medical management of that? So dopamine inhibits prolactin. So try to give a dopaminergic agent like bromocriptin, cabergoline, and all these drugs which are dopa stimulants. These dopaminergic things will come and inhibit prolactin, and prolactin inhibition on the FSH is gone. FSH will now improve and ovulation restore. So this is the story. If it is not, if it is a macro adenoma, already it is compressing, no, you have to treat. Now, doctor, 52-year-old woman presents because of the swelling of her hands for the past 3 months. This, I think you should answer correctly. Hey, we discussed rheumatology, man. Tight skin, shiny skin, gastroesophageal reflex, esophageal dysmotility. What is Vector? Sorry, what is telangiectasia? Scleroderma, doctor. Crust syndrome. Why did you not answer? I've even shown you the radiographs with all that calcification in the phalangeal tufts and all that. You didn't answer this or you did not read the question? That's the reason. Otherwise, you would have cracked. I know that. But please read all 200 questions are meant to be read in NEETPG, doctor. Hmm? So, calcinosis, Raynaud's phenomena, esophageal dysmotility, sclerodactyly, telangiectasis, crest syndrome is typically a feature of scleroderma. And what is the serological marker? This I think you know, anti-centromere antibody. Okay, doctor. Wolf Parkinson White syndrome, right? Patient is taking, there's a rash on his face and joint aches. One more case of drug induced lupus. So, what is the drug used to treat the atrial fibrillation in Wolf Parkinson syndrome? Can lead to the development of lupus. Drug induced lupus, very few drugs. And what is the drug? Procainamide. Agreed? See, doctor, atrial fibrillation. Atria are all jumping. Why do you use a drug like digoxin in atrial fibrillation? If atria has fibrillation, it's okay. But that should not come and affect the ventricle. Because if the ventricle goes into fibrillation, what will happen? You lost the chance of living. Right? You lost the chance of living. So how do you prevent that? You block the AV node. How can you do that? You stimulate vagal stimulation of the AV node will cause AV nodal block that prevent the atrial fibrillation from going into ventricle. That's the reason we use what? Digoxin. Because digoxin has got a vagomimetic action. It leads to the AV nodal block. It prevents the spread of the atrial fibrillation into the ventricle. That is the reason what is the treatment of choice for the atrial fibrillation to control the ventricular rate and preventing the atrial fibrillation from going into the ventricle, doctor? Huh? Digoxin. Second situation. You have Wolf Parkinson White syndrome. What is Wolf Parkinson White beta? There is an AV node. Nobody is listening to AV node. Here SA node is there. Directly there are reentrant pathways. Through that the conduction is happening into the ventricle. So here if atrial fibrillation is there, it is passing through this bypass pathways in Wolf Parkinson White syndrome. Agreed? So here if you give digoxin, what will happen? It causes AV node to block. Already AV node is crying. SA nodal electrical impulse is not passing through me. It is passing through the bypass tract. On the top of it, you brought digoxin and put on that. So what happened? This bypass pathway become more excited. Already this AV nodal fellow, you are not carrying him. On the top of it, I am more attractive. Come through me. And all atrial fibrillation will go into ventricle. Agreed? So it's like you are preparing for NEETPG. You are not even getting qualified. You are getting negative marks actually. And you love Gopika. Right? Gopika's daddy suddenly brought a USMLE 98 percentile match in shadi.com or sodi.com. Handsome hunk, looking smart, oh my God. But Gopi is thinking, oh, see, Gopika, మామూలుగానే నా ముఖం చూస్తలేవు. Normally only you are not watching my bloody stupid face, knowing that I'm not worth of NEETPG for the next 10 years I prepare also, I may not be getting. Your dad is showing USMLE, that's a handsome, hot guy. So that time, what should Gopi should do? Two options. Let him take yours. NEETPG only negative marking. USMLE fellow will stop conducting exam if Gopi goes and takes USMLE. So what Gopi will do? Night he sat. Who is this handsome uncle? So he found this boy that Gopika going to marry. In all parties, he is not with girls, but he is with other boys. Huh? He's sharing some nice kiss with another boy. Mil gaya sala. Then what he did, he took that photo and sent to Gopika. That is procainamide. Procainamide blocks the reentrant pathway selectively. That is what you need to do. That's the reason. Don't give digoxin in WPW syndrome atrial fibrillation, but give procainamide, which selectively inhibits the bypass tract, but procainamide can lead to lupus. That is always there. Okay. Now, doctor, 7-year-old boy is brought for evaluation of frequent falls. His mother says that for the past 9 months, he is moving more slowly than usual. He can't run, he can't climb, and he achieved all his developmental milestones earlier, 7-year-old boy. Then one of his uncle, Mama's brother, maternal uncle, Mama, died because of respiratory failure. This boy has hyperlordosis. And typically when he has to get up, no, that's called Gover sign. They hold the knee, then the thigh, then the another thigh. They'll be climbing on their own body and get up. That is called Gover sign in Duchenne's muscular dystrophy. Okay, just go to the YouTube and check Gover sign. And what Duchenne's muscular dystrophy guys will get, they get all fat infiltration into their calf muscle. That's called pseudo hypertrophy of the calf. So finally, Duchenne's muscular dystrophy, what is the inheritance? Straight बोल सकते ना sir? X-linked recessive. Next, doctor. 16-year-old kabaddi player fell on an outstretched hand. X-ray of the wrist is not showing any fracture, but he has a tenderness in anatomical snuff box. Which among the she looks to pretty try to catch her? Which proximal or distal? Which bone is affected? Scaphoid fracture. She looks too pretty. Scaphoid, lunate, triquetral, pisiform. So scaphoid fracture. So that's the reason what you do, put a thumb spica cast and repeat X-ray films after 2 to 3 weeks is considered to be the rule. 6-year-old boy has an IQ of 40. He was born 6 weeks premature. He was initially sitting at 11 months, saying his first words at 19 months, and walking at 22 months, and joined NEETPG coaching. Girija, what age you started walking? I'll call daddy and find out so that I'm handling correct person, right? I think by 11th month, I'm just joking, come on. So I know that you walked in at 11 months. So climbing upstairs at 4.5 years. Scissored gait is a feature of cerebral palsy. Why? Typically, the adductor muscles are there, no doctor, in cerebral palsy. They develop intense spasticity. Because of that, both get adducted and that lead to scissored gait. Right, is a feature of cerebral palsy. Then another important thing about cerebral palsy, favorite MCQ of examiner is, it is a non-progressive neurological disease. Whatever the cerebral palsy kid got his neurological dysfunction, that remains like that without progressing. At least that's a good news, right? Now, doctor, 46-year-old back pain for 2 days, that began while moving the furniture. And location of the pain, he puts entire hand flat on the lumbar region on the left of the spine. Straight leg rise of the left side is positive when it is able to replicate that radicular pain. So straight leg rise test is positive in disc prolapse. So intervertebral disc prolapse leading to compression of one nerve radical coming out. That's called radiculopathy, right? So give rest and non-steroidal anti-inflammatory drug is a treatment. 9-month-old has seizures, convulsions lasting under a minute, occurring in clusters, and suddenly the baby is having loss of tone, right? No longer able to sit down, and there are extensor type spasms of the neck and trunk. Extensor spasms of the neck and trunk. So, what is this syndrome, first of all? Always remember, answer is very easy. Whenever seizures are there, first thing you do is EEG and try to characterize what is the type of seizure. It's called West syndrome. What are the three things in West syndrome? Triad of features: infantile spasm, arrest of psychomotor development, and hips arrhythmic pattern, hips arrhythmia, hips arrhythmic pattern on EEG. The combination is called West syndrome. Okay, doc? Once more, Lennox-Gastaut syndrome, absent seizures, West syndrome, all this in the neurology. Right? Now, 24-year-old woman presents because of urinary problem. She has been stressed because she is working hard for NEETPG exam. Over the past 2 weeks, she finds herself continuously rushing to the bathroom because I feel I need to go, but I can't. She never happened to her before when she was in undergraduation. Undergraduation is a paid holiday. Oh my God, 4.5 years. College functions. Then second year, though, first year only we are sincere. Saraswati, Namastubhyam, Varade, Kamarupini will study like, because just we passed out of 12th, no. After anatomy, no. Pharmacology, microbiology, somebody, senior will tell you, hey, if you know streptococcus is gram positive, E. coli is gram negative, must. क्या रे तू पैरासाइटोलॉजी पढ़ रहे क्या पैरासाइटोलॉजी जाके पूछो 10 बैचेस तक हमारा असिस्टेंट प्रोफेसर जो है ना पीजी जो है ना ये हमारा सीनियर है पीजी बन गया उनसे पूछो कभी पैरासाइटोलॉजी पढ़ा क्या नहीं पढ़ा तू कह को तू कौन है पढ़ने वाले उठो कम ऑन then you will identify, oh my God, this is a paid holiday by daddy. Let me try, anybody will fall in love with me. So one falling, dumping, refalling, redumping. जिंदगी के सबसे बड़ी चीज क्या है बेटा कुलसुम जिंदगी के सबसे बड़ी चीज नहीं गिरने में नहीं मगर गिरकर हर दफा उठने में It is not about not falling but to fall every time and get up. Similarly, there is a modern saying in medical college also. जिंदगी के सबसे बड़ी चीज मोहब्बत में नहीं गिरने में नहीं मगर मोहब्बत में गिरकर हर दफा उठ के हमारे हमारे शबनम बोले तो क्या है व्हाट इज स्वीट हार्ट को क्या बोलते हैं अरे जरा हिंदी हमारे दिलरुबा के सहेली दिलरुबा को हमारे दिल में रुबा करने का है राइट so why did this came because of this patient okay no problem so this has never happened to her before because दिलरुबा के बाद दिलरुबा के बाद दिलरुबा तारिक के बाद तारिक बदल रहा है वो then she denies any fever, any dysuria, cystometry was performed. Then they found ditrusor contraction, which further exaggerated if you have given butanoic. So what is the most likely etiology for her? Oh my God, there's a bigger problem, multiple sclerosis. What is the other feature of multiple sclerosis? Stress is a predisposing factor, doctor. Stress is a predisposing factor, right? So, whenever multiple sclerosis is there, what will happen in the spinal cord? There is a demyelination. When there is a demyelination in the spinal cord, what is the center of control of the ping pons? So, from the pons, the fibers are passing to reach sacral cord. So this demyelination interrupted this pathway. So from the sacral cord, sacral part, no, your pelvic splanchnic nerve will give rise to what? Parasympathetic innervation to bladder that originates in the sacral cord, S2 to S4. And that is controlled by your pontine fibers. Pons fibers pass up to S2, S4. This demyelination interrupts it. Normally, its job is to inhibit. If that inhibition is gone, what happened to it? Overactivity. Overactivity of the parasympathetic innervation will cause the detrusor to go into excess contraction. That lead to spastic bladder, which is responsible. Amma. In today's story. So, how do you treat her? So you need to use antispasmodic drug that relieves. That means anticholinergic drug that make the bladder become soft. What are the soft group of drugs? Come on, Girija. SOFT. Oxybutynin, sulfasalazine. I too forgot FNT. If I forgot means you should forget. So please revise. Soft group of 4 anticholinergic drugs which are used to treat the spastic bladder because they are parasympatholytic and relieve the detrusor spasm is what you need to remember. All you read in T for ek bar aur ek bar dekho. No problem. After going home, no issue. 2-year-old writhing movement. Yesterday I gave you some homework to check in WhatsApp, no? Did I give any homework yesterday, Kulsum? No? Every day I'll give homework after going home, check that and then put it in our WhatsApp group, Super 30 group. 2-year-old boy, writhing movement. This movement started 2 weeks ago. Quick jerking movements. He has not pulled himself standing yet, but can crawl. 2 years crawling means not good. Then there is a gross hypertonia. Creatinine is 2. Blood urea nitrogen is 28. And his mother reports he's trying to hit himself with his fist. That's called auto-mutilation. Self-mutilation. Self-mutilation and renal dysfunction with hyperuricemia. These are all the features of Lesch-Dehaene syndrome. What is that? Lesch, first time knowing that in NEETPG exam is very bad. Right? If you come to know first time that this is existent on the planet Earth, very bad. I will not let you to do that. Abhi shuru kiya na. You are in first year of PG preparation. Right? So, biochemistry will read na. माहिर बन जाएंगे 50 पेजेस में पूरा दुनिया ये सब चीजें रहता उसमें उससे ज्यादा कुछ भी नहीं रहता अच्छा भैया HGPRT మీరు విన్నారా రెడ్డి గారు హైపోక్సాంథిన్ గ్వానిన్ ఫాస్ఫో రైబోసైల్ transferase. Where do you find this? In the metabolism of purines. If this is not there, Correct. We studied that in gout. Lesch-Nyhan syndrome will have hyperuricemia. They have gout. Correct? Last life? This life? Last month. Okay. Purines. If HGPRT is not there, no. Hamara. Girija, Sai Teja, Kulsu Muhammad, Abhi Sushant. I'm betting you, doctor, you will be in the top 1,000. If you are not, I'll stop coaching. It's a disservice I'm doing to the humanity if you don't get the seat. Because every day you are coming. But only one more thing. Every day you should also study the notes that we completed. If you promise me that, you will get. Somebody said, a lot of students will join if you give rank guarantee coaching program. Achha. Controversial cheating case rank guarantee तुम तो दे दो ना. One of the student called and said, मैं भले पेर वेटर सर, नेल्लूर student. मैं भले वेटर rank guaranteed sir. You'll get some other rank. I don't guarantee top rank. I said some rank is guaranteed. అంటే క్వాలిఫై కాకపోయినా కూడా ర్యాంక్ వస్తుంది సార్. Yeah, that's what we want to say. But you study well, you'll definitely get a reasonable rank so that some girl in shadi.com will agree. Nowadays, they are asking you to put your VDRL, retroviral report, COVID report, vaccine status, and NEETPG rank card. 5 things in shadi.com to be placed, right? So, Lesch-Nyhan syndrome is HGPRT deficiency will cause purines no more metabolized and they convert into hyperuricemia, leading to gout. This is the classic. And it's X-linked recessive. Please remember, once more, like your Duchenne's muscular dystrophy. 82-year-old retired army colonel is brought to the clinic by his son. He says, my daddy is more forgetful. He cannot follow instruction. He is unable to drive his car, manage his checkbook. MMSE 17. Out of all this, what is the criteria that establish the diagnosis of Alzheimer's? Gradual onset of symptoms, continuing cognitive decline is a sign of Alzheimer's. In Alzheimer's, what is the drug we use, doctor, which will increase the acetylcholine levels in the brain? Yesterday I told. Thakreen. Donepezil and thakreen. What they do, selectively inhibit the acetylcholine esterase in the brain and increase the acetylcholine levels. Decreased acetylcholine levels are considered to be the cause of the dementia in case of Alzheimer's. 82-year-old, non-productive cough, 9 kg weight loss, bilateral breast enlargement in the past 6 months. What is he having? Gynecomastia. But dry cough. Then there is a CT shown in the figure. Obviously, it is showing a mass lesion. What are the 2 tumors which are central, doctor? SSC, I told you. Small cell, squamous cell carcinoma are central, right? Whereas large cell is somewhere, generally it will be like this. Not exactly central. Central means here it should be. Adenocarcinoma is also peripheral. So, large cell carcinoma can cause gynecomastia as a paraneoplastic syndrome. Most of the endocrine paraneoplastic syndromes that you see are all seen in which variety? Small cell carcinoma. Small cell carcinoma. The only endocrine manifestation shown by squamous cell carcinoma is hypercalcemia, because it produces parathormone like protein. Who? Squamous cell carcinoma. Otherwise, most of the endocrine are all small cell. Between the two, which will rapidly spread? Small. Chotu bhagta hai, har jagah bhagta hai. He will go to adrenal, he will go everywhere, to the liver and all. That's the reason there is no role for surgery in the treatment of small cell carcinoma. Only you can give chemo or radio. Whereas radio, highly responsive is squamous cell carcinoma. You can even do surgery. What is that squamous cell carcinoma which occur in the apex of the lung called as Pancoast tumor? It can lead to Horner syndrome. How will you test Horner syndrome? By instilling what? And showing that there is no dilatation. Yesterday we read that. One of the indirect acting sympathomimetic drug. What is that? Cocaine. Flashback, doctor, flashback. Huh? See what happens now? First time when you are understanding, no, you feel you understood. But I always tell, how will you know whether you understood or not? The moment you are able to explain to your friend on a piece of paper, that time you get confused. So, इसलिए Dr. Reddy is there, no? Huh? Your cousin. You tell, भाई तो 1 लाख रुपीस वहां कोचिंग में ज्वाइन हुए तो भी 0 रुपीस में मुरली भरद्वाज सर अवेलेबल है. If I'm really telling you, if you are sitting with 1,000 students, you won't crack. You sit with one Girija, chalu, 1000 మంది కౌరవులకి సమానము కదా. So one Girija is enough to give you enough revision. You challenge him, you explain him, let him challenge you back. That is the best way to become good. What do you say, doctor? That's why I always tell, if time is there, come 1 hour before. Take the one of you volunteer to ask questions from that notes I have given. Others keep answering. That way you see as a group how fast you can do the revision. You can convert the sentences into questions now. खेलते खेलते पढ़ सकते. 1 घंटा पहले आओ, सब लोग 1 घंटा पहले आके नोट्स लेके, where is finasteride, what is the 5-alpha reductase inhibitor? Tak, one will say finasteride. Okay, what is androgen receptor antagonist? Tak, another will say flutamide. Right? Between Eaton Lambert and myasthenia gravis, where will you have normal DTR? Between myasthenia gravis and Eaton Lambert, where will you have normal deep tendon reflexes and where will you have areflexia? Great! And normal reflexes in Adi. What are the receptors which are affected in, what channels are affected in Eaton Lambert? Calcium channels. Super. And which cancer do you get? Paraneoplastic syndrome, Eaton Lambert? That is myasthenia. Which lung cancer? Small cell lung cancer. ఇట్లా లేకుంటే నేను 1 గంట ముందు వచ్చి ఆడుకుందామంటే ఆడదాం. రోజు గిదేగా చూస్తున్నది. You will get bored of me in few more days. Same voice, same noise. Right? ఫస్ట్ టైం నేను చెప్పి నోట్స్ ఇచ్చేసినాక, after I give the notes, after finishing first round, you have to drill and finish. So all you 5 will be there in the exam hall, no? You'll be looking at each other's face and laughing, looking at the question opposite you. Right? उस दिन हमने एड्रोफोनियम टेस्ट, चल myasthenia gravis में, pyridostigmine, चल myasthenia gravis में, post infectious polyneuritis, चल Guillain-Barré syndrome. Guillain-Barré syndrome is symmetrical. Bloody, this is what we are expecting now. You will give IV immunoglobulin, but steroids have no role in Guillain-Barré. That's what exactly he asked. You will do plasmapheresis, Guillain-Barré. Posse immune, then you will look, posse immune. Bloody, I know what are posse immune. What are immune complex? I know what are small vessel vasculitis. Henoch-Conlin purpura is small vessel, medium or large? Beautiful. And Kawasaki disease is small vessel, medium or large? Medium. What is pulseless disease? Which vasculitis lead to pulseless disease? Pulseless disease because subclavian is blocked because arch of aorta. Huh? Oh, Takayasu arthritis. Right? Rubude, man chadina kada Takayasu arthritis is arch of aorta. Aortitis. And because of that, arch of aorta is affected, means subclavian leaving the aorta will become narrowed, and that lead to the pulselessness typically in a young, sweet Asian female presenting with hypertension. And when you are checked, pulselessness is not there, then pulselessness is there, then what did you do? Arch of aorta. You did a angio and then found arch of aorta fully enlarged. That's an example of Takayasu arthritis. Elderly man, severe headache, high ESR, pulsating temporal. What is the answer? Giant cell arthritis. Giant cell arthritis is the other end of the spectrum of which condition? Polymyalgia rheumatica. In both of them, there will be a jaw claudication, right? And how do you treat giant cell arthritis? If you don't treat in emergency, what will happen? Steroid, methylprednisolone you will give. If you don't give, and you will be waiting for biopsy report, blindness will come, right? Garma garam jadale Murli Bharadwaj kids, whose blood? Murli Bharadwaj blood and the lineage of Murli Bharadwaj means Bartter syndrome, Littleman syndrome, Gentleman syndrome, right? What is type 4 renal tubular acidosis? What is the cause of type 4 renal tubular acidosis, doctor? Hyporeninemic hypoaldosteronism, because juxtaglomerular apparatus is having aplasia in diabetic nephropathy individuals. If diabetic nephropathy is there, juxtaglomerular apparatus is hypoplastic, renin is not produced, angiotensin is not produced, aldosterone is not produced. Then why there is an acidosis? Normally, what will aldosterone will do? It will come to the collecting duct. It causes the sodium retention and loss of potassium and H plus into urine. If there is no aldosterone, potassium and H plus don't go into urine, they come back into plasma. That's the reason it produces hyperkalemia along with the acidosis because of the retention of H plus. So this kind of an acidosis because of the problem at the level of the renal is called as renal tubular acidosis type 4. Type 4. And where do you see that? Every day in and day out in the clinical practice, diabetic people get diabetic nephropathy people develop acidosis with hyperkalemia, and the underlying cause is renal tubular acidosis type 4, right? And why do you need to remember? Renal tubular acidosis type 1 is distal renal tubule problem, type 2 is proximal renal tubule problem. In both the type 1 and type 2 renal tubular acidosis, there is an acidosis with hypokalemia. Only type 4 renal tubular acidosis, there is a hyperkalemia with acidosis. Just a beginning. We'll finish nephrology. Aega. Huh? Then revision karenge and will master. All right, doctor, I'll write. I never know where to stop if it is general medicine. Huh? ఇరవై మూడేళ్ల నుంచి గిదే రుబ్బుతున్నాం కాబట్టి ఇట్లా బుర్రని vocal diarrhea ఉంటుంది. Don't worry. But teachers' vocal diarrhea, students' mental constipation should both match somewhere. Then it should become a equivalent. 34-year-old patient with history of asthma, with shortness of breath, wheezing. He is able to tolerate pulmonary function test. Then what do you see in pulmonary function test in asthma? Asthma is what? Obstructive lung disease. What happens to FEV1, FVC in restrictive versus obstructive? This we discussed. FEV1, FVC, residual volume, total lung capacity, you basically check in spirometry. If it is obstructive lung disease, what will happen, doctor? At the end of expiration, it is not able to expel the air, so you have hyperinflated lung, increased residual volume, increased total lung capacity. Whereas in restrictive disease like sarcoidosis, these lung volumes are just less than normal. They are not increased. In both restrictive and obstructive, FEV1 and FVC are reduced, but in obstructive, FEV1 is more dramatically reduced. That's the reason FEV1 by FVC ratio is significantly decreased, right? Whereas FEV1 by FVC is normal in restrictive lung disease, whereas FEV1 by FVC is significantly decreased because FEV1 dramatically decreased, so both of them are decreased in obstructive. That is the favorite question of the examiner. 4-year-old boy comes to emergency, difficulty breathing, and what is this sign, doctor? What can you see here? Thumb sign, anguta chap, right? That is epiglottitis caused by H influenza. And that you treat by immediate intubation. Otherwise, respiratory embarrassment and respiratory arrest will occur. Now, severe meconium aspiration syndrome means mechanical ventilation required more than 48 hours. So basically, meconium aspiration is defined into mild, moderate, severe. If you don't know, you can't guess. Take it away. Then a baby has a transposition of the great vessels. What will you do? We do Rasteli operation, arterial switch procedure. Why prostaglandin even is needed? What is transposition? Left ventricle, right ventricle. What is transposition doing? Pulmonary artery opening into left. Aorta opening into right ventricle. Instead of into pulmonary artery. Right ventricle opening into aorta rather than into pulmonary artery. Agreed? Right जाके aorta left वाले में जा रहे हैं और left ventricle pulmonary artery right वाले में जा रहे हैं और कहीं और switch होना है. So you turn like this, then you need to turn it back like this. So how can that happen? If you do PDA, which is connecting pulmonary artery and aorta, what will then happen? From the left ventricle, blood will go into pulmonary artery. Then pulmonary artery will tell, hey, all oxygenated blood is coming to me. I am a dirty, bloody, stupid pulmonary artery which is supposed to carry dirty, gandha blood. Huh? So what it will do? It will tell aorta, hey, tera blood mujhe mil gaya re. Then it will, if the PDA is open, what will it do? It will go back to aorta, and aorta blood will come back to into pulmonary artery. For that, what should be maintained? English channel between Britain and UK and France must be open. That's the reason you give PGE1 infusion. Arterial switch means ये निकाल के इधर लगा के ये निकाल के उधर लगा रहे, simple. काट के. Rasteli also will do that. So these are all the things that are basically done. Commonest cause of cardiac tamponade is what, doctor? In a neonate, pneumopericardium. So whenever you are doing any catheterization, then that can cause the injury. What are the absolute, relative, indications for mechanical ventilation? Doctor, I leave the literature for you. Prolonged apnea, PaO2 below 50, PaCO2 above 60, general anesthesia absolute, then you have some relative indications. The most common sequel of CMV infection is sensorineural hearing loss. Renal vein thrombosis in a newborn is because of diabetic mother, dehydration, sepsis. They are all the causes of renal vein thrombosis. How many congenital heart diseases do you find, doctor? The erstwhile Chief Minister YSR is very popular for what? So many Arogyashri congenital heart diseases were operated. Probably all those kids would have died if not for that Great healthcare intervention. Yatra, you have seen movie? Marugaina Varajanna. Congenital heart disease is 6 to 8 per 1000. Then, which antigen is not the cause of hemolytic? I told you, no. Lewis lives, Kelly kills, Duffy dies. Duffy group dies, Kelly kills, but Lewis group lives. They are just like RH antigen, they're all the other antigens. What is the most accurate statement about varicella, doctor? Varicella means chickenpox reactivation is called varicella. So varicella lesion appear in stages or crops, that is pleomorphic rash. Different, I mean, scabs, vesicles, everything will be there. Whereas smallpox lesions are uniformly in the same stage. That is the main difference. So we don't see smallpox, still it will be seen in entrance exam. A term newborn is delivered by emergent cesarean, and typically his Apgar scores are low. That means he is having seizures, means it is hypoxic encephalopathy, ischemic encephalopathy leading to seizures. 21-year-old with a rash. What is this, doctor? Christmas tree pattern with a herald patch, which is seen with Pityriasis rosea. Right? Not versicolor. Oh, Girijaka. What is Pityriasis versicolor? Malassezia furfur. And what is the typical pattern? Spaghetti meatball appearance. Okay, revision. Okay, because we finished in musculoskeletal and skin and all that, no? I mean, are you guys coming to the class because, okay, some fun every day, okay? Life is very barren with NEETPG preparation. Thoda stand-up comedy show will be there. Mere revision cheyakunte, I am a stand-up comedian. Okay? So please do revision, doctor. Good to see 14 more in the today's stand-up comedy show. Good, doctor. Tell your friends, every Sunday we have no other job. 21-year-old, intensely pruritic rash on both hands and the right cheek. Vesicles, erythematous plaques arranged linearly with slight crusting. He does not have history of eczema. Only now. Why? Because he touched his girlfriend. It is a contact dermatitis is what you need to remember. Atopy means past history will be there. That's how you differentiate. 46-year-old man came for the evaluation of the mole. What is ABCD, doctor? Asymmetry, border, color, variegated color. D is diameter. That says that whether the mole is malignant or not malignant. 26-year-old man with the burns on his chest, and the burns occurred an hour ago. And how are the burns? Painful. You remember burn classification? Superficial burns, deep burns, in that upper dermis, lower dermis, and severe burns. So all this description is about the superficial burns because they're painful. So that's the reason what you need to do, doctor. Clean, dress, and analgesics as needed. 52-year-old, past medical history, new rash, and mildly pruritic, hyperpigmented, thick plaques are seen. So what is this, doctor? Acanthosis nigricans. If this is there, what is an indication of? Diabetes. That's the reason you need to do fasting blood glucose. Mean airway pressure is affected by what? Inspiratory time, peak value, peak inspiratory pressure. See, doctor, there are about 1,500 stupid points in anesthesia for those 5 marks, which is 5 into 50,000, 250,000. So, 1,500 anesthesia. Totally 20 pages, 20 simple pages. That means 10 this side, 10 this side means 10 pages. What will you tell? These 10 are my checks. Each is valuing 5 into 50,000, 2 lakh 50, 10 checks. 25,000 check each. If you master one page in our notes, remember 25,000 rupees worth. Right? So, इसलिए थोड़ा कुछ ना कुछ करो. Ready करो. You have to take a lead. Make all us sit together. Huh? Don't go through their 1 lakh rupee notes. That is very fat notes. Huh? उसको पढ़ने में ही हमारा दम निकल जाएगा. Right? So this is very smooth and soft notes. So volatile anesthetic with least hepatotoxicity, sevoflurane. Right? Size of soda lime granules, septic pit latrine depth also you need to remember. You know that, doctor? That's called NEETPG preparation. And still we have not yet done the SPM completed. Which mosquito will stand like this and ovulate? Which will be doing backwater swimming and ovulate? How do you differentiate which is tiger mosquito, Aedes? Huh? All these things we have to. Machharology is still there. Huh? The size of soda lime granules, 4 to 8 mesh. Cyclopropane is orange. मजे में पढ़ना है सब, रोते नहीं. रोए तो you don't know what is pseudo dementia? Huh? Discussion, what is meant by pseudo dementia? Depression brings dementia. Mania brings NEETPG seat. That's the reason even midnight, 3 o'clock also. So yesterday, I watched a movie, finished 2 pegs, about to go to rest. I thought, okay, let me ask 10 questions in the group and see how many fellows will leave the group. Nobody left. Morning, 1 or 2 left. But another 5 to 10 came and joined. No worries. So, renal failure, what is the anesthetic of choice? Enflurane, methoxyflurane are nephrotoxic, so isoflurane can be given. 64-year-old schizophrenic says, I am the prime minister and all these doctors are terrorists and trying to destroy him. The patient is poorly groomed. In time, the people is going to worship me like God. Next promotion from prime minister is directly God. So what is the patient should receive immediately? Haloperidol. Therapy with typical neuroleptics like haloperidol, not halothane, haloperidol, chloropromazine, they're all good for positive symptoms. Schizophrenia में क्या रहता? Negative symptoms, positive symptoms. Typical, atypical. Clozapine like drugs are all atypical. Atypical are good for negative symptoms. Typical are good for only positive symptoms like hallucination, delusion, agitation. And these typical neuroleptics have very little effect on negative symptoms. 25 months with upper respiratory infection, very poor eye contact. The child responds to smiles with disinterest. The mother looks distressed. अरे मन साई कृष्ण रेड्डी साहब कहाँ है? किसका शादी है भाई? इनका गर्लफ्रेंड का शादी है क्या? इतना बिजी है? I'm a big addict of Sai Krishna Reddy. Sai Krishna Reddy, I mean, I'm a straight guy, but don't mistake me. I'm addicted to Sai Krishna Reddy. Always some kind of energy. Lawrence को क्या हो गया? मतलब फोन नहीं बना ఉన్నదే 10 మంది బట్ ఉన్న వాళ్ళు పాపం రాకుంటే ఏం చేస్తున్నారు జీవితంలో So very big problem, doctor. See, the problem of our life is perseverance. We are very badly missing Amita. Amita is missing in the class, and Varsha, anyway, from beginning only, she said, "Sir, don't get addicted to me. I told you I'll come whenever I want to. Don't stalk me." Girijata, we do stalking. If you don't come, we'll call. Where is your GPS? Where are you located? Then we wear this and then come looking for Girija. So Monica is missing. So most important thing in preparation is 2 days dropping is okay. 3 days dropping is delayed physiological jaundice. Beyond 4 days not coming to class is pathological jaundice. Tell Sai Krishna Reddy. We are all getting.
Married is waiting for Aishwarya.
No, no. Did he go to marriage or he is accompanying them to honeymoon also? So quickly ask him to come. I'm really missing. I want, because my gut feeling is Sai Krishna Reddy is the future cardiothoracic surgeon of Karnool. Reddy గారు మీ ఫేవరెట్ బ్రాంచ్ ఏంటి? జనరల్ మెడిసిన్. విల్ ప్రాక్టీస్ టుగెదర్, రైట్? సో जनरल आफ्टर दैट पहला ये खत्म करने के बाद कार्डियोलॉजी ना न्यूरोलॉजी rheumatology, that all decides upon the boss. Huh? What type of boss and different situations of life. If you get a good father-in-law who can contribute, sponsor for good hospital. Fevers, one dengue season is enough for you to become a millionaire. One more wave of corona is enough for you to become a billionaire. MD general medicine is emperor, right? Cardiologists can't become billionaires during COVID. Only one of my cardiologist friends was saying, "ए क्या फालतू practice करते रहे हम टूडी को करके 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 बुढ़ा हो गया." ए physician देखो, one corona finish, specially bought new ventilators, and every case comes means 2 lakhs, 3 lakhs minimum. Whether finally you give that only doxycycline, peppermint tablets, poppins, vitamin C, lemon juice, right? That only. And virus, if it wants, it will not kill. If it wants, it will kill. Your job is 2.5 lakhs, right? So doctor, what is this condition? So this is a classical story of autism. First look at the age, doctor. 25 months old baby is a clue, right? So whenever autism is there, they have a problem of poor social interaction. The child will have little eye contact, have few peer interactions, will not engage in appropriate interest sharing activity, etc., etc., etc. Now my 43-year-old doctor, woman is brought by the police after being found wandering around the local park in a nightgown. I like to know what is that park. So her brother is called and he reports that there is a worsening in impulse control. Oh my God, we also suffer the same disorder of impulse control, right? So she was disrobing. This is very serious. Disrobing in the public. Occasionally she laughs at unknown stimuli and cannot be redirected during these emotional outbursts. Over the past 1 month, she has become voracious eater. She was fired. What is she eating? Food only, no? And her job, she was fired as a postal worker for 12 months ago for inappropriate behavior. So what is this called, doctor? Kluver-Bucy syndrome. See, we have a limbic system, doctor. Amygdala, hippocampus, they will be thinking about what we should eat, whom we should eat, and what kind of orientation we need to have, sexuality. Smell is one of the strongest stimulant of erotic libido. So all this is processed in Pepes circuit. What is that called? Pepes circuit. This will be thinking today with whom to have sex, Is it chicken before sex, after sex, or while having sex? Button कहेंगे क्या करना है वो सब कहाँ होता है बेटा? Pepys circuit. So whenever this amygdala, hippocampus, they're all closely related to the medial aspect of the temporal lobe. Temporal lobe is a very tempting lobe, temptuous lobe in brain. So whenever there is any lesion, then one more important thing is frontal lobe also. All our inhibitions are because of, we know that she's our friend's wife, friend's girlfriend. Though our friend went for counseling, still we should treat her like friend's girlfriend only, not our girlfriend, right? So who will tell us that discretion? Frontal lobe will tell, hey, don't do this. Please don't do this way. It will tell frontal lobe. If your frontal lobe is having problem, then what will happen? Disinhibition. You lose everything, leave everything, and then run around, right? Sometimes frontal lobe infarcts, frontal lobe predominantly by antecerebral artery. So frontal lobe dementias, frontal lobe infarcts, they develop hyperorality, hypersexuality, perseverative speech behavior. It's all called Kluver-Bucy syndrome is what you need to remember. Pepys circuit, amygdala, hippocampus, right, which are important for memory, sex, libido, all these things. Then 23-year-old man is brought having attacked his next door neighbor with a cricket bat. The police shot the suspect twice in the leg, and at one point during the struggle, patient screamed out, I am the hand of Satan, you cannot beat me. Right? So that is a great challenge for us as doctors, doctor. What kind of crazy patient will come, we don't know. And always patient has liberty to be crazy. You are supposed to be holy. How can that happen? हम तो पहले क्रेजी है इसलिए नीट पीजी में सीट है आके पोस्ट ग्रेजुएट बना ऊपर से patient is crazy. A crazy guy treating a crazy guy in a crazy environment of what? Casualty. That's the reason it's called casualty. So, what happened? His urine is positive for myoglobinuria. He is receiving a drug actually, which goes and blocks the N-methyl D-aspartate, NMDA receptor. And that is phencyclidine. Okay, I'll ask one question. Homework. Which anesthetic agent also acts on NMDA receptor? N-methyl D-aspartate receptor. Check it and tell. Batate kya? If I give a clue, you will answer. Clue? It starts with the letter K. ఒక్కటే తెలుసు కదా మనకి కే మీద వచ్చే ఎనస్థీషియా మొత్తం ఎనస్థీషియాలో కే మీద క్యా ఆతా అంతే ketamine. Ketamine also acts on NMDA receptor. That's the reason if you administer ketamine, no, there is a thing called emergence delirium. Patient will become like a guy who took phencyclidine. And he too can tell you, hey, doctor, why are you giving me anesthesia? I'm the hand of Satan and you cannot beat me like this, he can say, right? Emergence delirium of NMDA receptor, ketamine. Okay? Now, doctor, 46-year-old woman is brought attempting to rob the jewelry. And when the police caught her, she said, actually, police commissioner wanted me to do this. And patient says, she's goddess Durga and she's carrying the word of the Almighty. She reports and hears to God Vishnu talking to her throughout the day. She says she feels fantastic. Almost for a week without sleeping. Abba. 1 week without sleeping means only Murli Bharadwaj can be like that while giving coaching because I have to prepare everyday notes. All 1500 pages are not ready. Only 700-800 pages are ready. Remaining, I have to prepare every day 20-30 pages. Girija. So much hard work, so many cups of tea. Past 25 years, my girl Sapna Bharadwaj is preparing. Huh? Still, she patiently gives to Dr. Saab because she knows me that I am a maniac right from MBBS days. Right? So I'll give a feedback that Garelu are good. Eh? Okay. So you missed uh, Kulsum. Tomorrow I'll bring nice pakodis. Hai kya? Khaya? Are? हाँ. So remember, I'm also becoming like Satya Sai Baba. Not only coaching, like Vibhuti, I'll give garlic with avakaya, and if you eat those gar like a goud asthma mandu, fish medicine of goud, will give one gar every Sunday, and your scores in NEETPG will improve. So her speech is significantly pressured. She is easily distracted. What is your diagnosis? Bipolar 1 disorder. Malla gidendi sir. One okati, rendu okati. What is the difference between the two? Bipolar 1 may you have mania. Bipolar 2 less mania. ఇక్కడ తిక్కకి లెక్క ఉంది, ఇడ లెక్క లేదు. Hypomania, mania. This is called mania. This is called less than mania, which is hypomania. Bipolar 1 can be associated with psychotic symptoms like delusional hallucination in this lady. But if there are no psychotic symptoms, then you call type 2. Electroconvulsive therapy is usually used in non-responding case of bipolar 1. Whereas bipolar 2, because there are no psychotic symptoms, you treat with psychotherapy, cognitive behavioral therapy, in addition to the depression drugs, mania drugs. Understood? Psychotic mood disorder is 1 better. No psychosis, only mood disorder is 2. Simple. Easy, but this is a favorite MCQ. Where will you give ECT, electroconvulsive therapy? In 1, but not 2. Whereas in heart block, Mobitz type 1 and 2, where will you put pacemaker? Malla kade mat. Venki back phenomena 1, and that is okay, Gopi Gopika. 2, sudden drop. That's the point. Petrol అయిపోయిందా? Are you? Can you still? चार तो 10 घंटे. He's used to 10 hours abuse. ये क्या है सर? कुछ भी नहीं है. 2 घंटे is nothing. Whereas other coaching centers throughout the day, his stamina तो అన్న మీరు టాపర్ అన్న, మీ కెపాసిటీ మేము తట్టుకోలేమన్నా. Good to see Dr. Seshi Topo and many more who are all online. We'll give a 2-minute voice break. See, stamina, doctor, stamina. 150 వరకు కొడదాం. కొట్టి we'll call Jai Hind. But next week, at least మనం ఇంకో 2-3 weeks నుంచి we have to see that we finish 200, right? I mean, if there is no lot of explanation needed, if you solved all 200 questions, easy for me to complete 200, let me tell you. But आप तो 100 खत्म करके बैठ गए. पूरा किया क्या पेपर? All 200 and got the score, found that you are getting negative marks? No? Okay. And including most biggest studies in the welcome back to the discussion, doctor. Now, a 65-year-old female underwent total hip replacement surgery and later developed a chlorhydric type of chest pain and hemoptysis. You know the diagnosis, pulmonary embolism post-operatively. So how do you prove that? Gold standard is CT pulmonary angiogram. Erlen-Meyer flask deformity. See, here you are able to see, no, a flask-like deformity, right? Which is called Erlen-Meyer flask deformity, where there's a relative constriction of the diaphysis. Diaphysis is the shaft. Epiphysis is the growing end. Metaphysis is between dia and epi. There's a list of causes that you need to remember. Goiter's is one favorite underlying cause. Whenever there is an acute abdomen, what is the most important investigation, doctor? Plain X-ray. What will you look for? Gas under diaphragm is a common thing that you need to look for. Lumbar spine instability at L4, L5, what are the criteria? This is pure orthopedic question. This kind of questions, no, doctor, not at all high yield, but they are given to check your temptation for negative marks. Don't go into the FOMO. Fear of missing out is not good in entrance exam, because 200 questions may 20 questions will be stupid questions like this. Thala toka undadu. But examiner will give it because he want to create that FOMO and tempt you, and you will end up in doing wrong, and that will cause minus 20, which is equivalent to 20 into 50,000, 10 lakh rupees, 1 million gone. Kaun banega Karodpati program? So be sure. Medico-legal action can be initiated if the radiologist lost the films, misinterpretation, not comparing. That's the reason every radiology report, what will they put? Correlate clinically. Colonic diverticulosis. Colonic diverticula are not true diverticulae, but they are false or pulsion diverticulae. What is the arterial mean pressure in a critically patient that need to be maintained? 100 is what you need to maintain. Eyelid repair. From where will you pick up the skin? Post-auricular skin you will take out to repair the eyelid defect. Voice of America, you know, no? Vena caval opening 8 to 10 is a phageal opening. Intestinal obstruction adults most commonly is because of post-operative adhesions. Ranula is not a cannula. It is a mucus extravasation of cyst of sublingual gland. Superior parathyroid is 4. Inferior is 3. Radio-opaque stones are all calcium oxalate stones. Acute small bowel obstruction is because of adhesions. Fructose in seminal vesicles is seminal fluid is because of the production that happens from seminal vesicle. CA99 is a marker of carcinoma pancreas. What is gastrinoma triangle? Where maximum gastrinomas. What is the syndrome of gastrinoma called as? Recurrent refractory duodenal ulcers in spite of treatment. Zollinger-Ellison syndrome, no, it is gastrinoma. So, liver के नीचे क्या है? Gallbladder. Gallbladder का duct क्या है? Cystic duct. So, cystic duct, common bile duct, and the pancreas, neck and body junction, and the second and third part of the duodenum. This is the area where you get the gastrinomas very frequently, is what need to be remembered. Colorectal cancer most commonly is in rectosigmoid junction. Early gastric carcinoma. You know which country gastric carcinomas are very common? Japan. They eat a lot of smoked food, no? So the depth of the tumor invasion is the way by which you will be doing the staging of the gastric carcinoma. 24-year-old male presents with abdominal distension, severe right lower quadrant pain. He was dehydrated, marked tenderness all over the abdomen, maximally in the right lower quadrant. What is the diagnosis, doctor? Right side क्या रहता? Right side. Appendix, ileum, and all that. So typically, oh, Suresh Naidu garu, acha, sponsored by Teja, na? Good. Teja also gave two nice spectacles, no? You gave it as a gift, huh? My younger kid wore that specs and went to school. Principal called. क्या है सर आप ही एग्जीबिशनिस्ट नंबर 1 बोले तो आपका बेटा तो आपके बाबा आपका आपके भी एक्सेसिव एग्जीबिशन हो रहे हैं नो वॉच नो गॉगल्स इन द स्कूल की साइड बकवास रूल है नेक्स्ट आई टेक हिम एंड पुट इन ZPHS जिला परिषद हाई स्कूल आई सेड no rules. So thank you for the goggles you gifted. Typhoid ileal perforation. A woman was involved in a road traffic accident and brought to emergency. Oh, actually, she was tachypneic. On inspiration, a segment of her chest wall was sucked into the chest. What is that? Flail chest. What is the meaning of normally? Intercostal space will distend when you are inspiring and collapse while you are expiring. But reverse is there. While you are taking inspiration, if it collapses, that's called flail chest. Where do you get flail chest? When the rib got fractured in two locations, you get flail chest. Commonest cancer in the male globally is lung cancer. Acute ischemic ulcer in the leg in a young man. Did you answer this? Bourger. Thombangitis obliterans. After eating a very large Sunday lunch with alcohol, 42-year-old man vomits several times. Chest pain is there. Chest X-ray shows shadowing of the left zone. Right? All air, pneumomediastinum. Because of the esophageal rupture, because of intense retching, which is called Boyer-Harvey syndrome, is what you need to remember. Coming to the esophageal diverticulae, pulsion are all false diverticulae. Junker is a pulsion diverticulum. And they are often associated with esophageal motility disorders, is what you need to remember. And the pulsion diverticulum, where do you see? I mean, most of the esophageal diverticulae are all pulsion diverticulae noticed at the level of the cricopharyngeus muscle, is what you need to remember. Pulsion falls only, no? Oh, sorry. Most esophageal are not. That's also false, no? I think this we need to correct it. So, true, there are also true diverticulae found in esophagus. It is found in middle 1/3 of the thoracic esophagus in peribronchial location due to the mediastinal inflammatory lesions like TB and histoplasma. So that is the reason between false and true are more common diverticulae in esophagus. That's the point we need to understand. Peptic, am I going too fast? Okay, no? The second part is all very easy. First 100 energy hai. Peptic ulcer in the posterior wall or the first part of duodenum, commonly what vessel? Gastroduodenal artery. You remember? Gastroepiploic artery, whose branch it is, hepatic artery, whose branch it is, celiac artery branches, 3 branches are there. Toda revision. Then, but did you answer this question correctly? In spite of knowing all those things, sir. You did not. Next time, Ninchi, think that you could will put one clock. So, tuck, 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 tuck. 3 hours, can I finish all 200 or not? Keep trying out. Gastroesophageal reflux typically lead to nocturnal cough. That's the reason nighttime anybody is coughing means all cough is not lung. It is gastroesophageal reflux. We're all becoming obese, solitary, and sedentary life, right? So we'll organize one table tennis table here so that in the middle you can play, sweat yourself, then sit, finish 10 pages revision, once more go and play another game. That's how preparation should be, not 10 hours class in a Tihar jail. So for a few days I will be continuing in the reverberation. Bear with me. 56-year-old chronic alcohol consumer presents with shock because of the bleeding esophageal varices. What is the treatment of choice, doctor? Endoscopic ligation, endoscopy, sclerotherapy. These are all the various things that you do. Today, there is no place in the gut that cannot be reached by an endoscopist. Right? So, the region most commonly involved in ischemic colitis, watershed zone, splenic flexure. You have the transverse colon, no, doctor? Then descending colon. Right? So, this area is the area between inferior mesenteric artery and the middle one. So, this is most vulnerable. Hyperchloremic metabolic acidosis is renal tubular acidosis. Why will it be hyperchloremic? Why will it be hyperchloremic? See, renal tubular acidosis once more is proximal renal tubule and you have distal renal tubule, doctor. In the proximal renal, what is meant by proximal renal tubular acidosis? It is also called type 2, though it is proximal, like our clonidine and alpha 1, alpha 2 receptors. Distal is type 1. So, for example, if you take proximal renal tubular acidosis, whenever the proximal tubule is not working, proximal tubule is the place where bicarbonate reabsorption occurs. So, bicarbonate reabsorption doesn't occur, that lead to bicarbonatenuria and that lead to acidosis. Generally, bicarbonate is a negative ion, chloride is a negative ion. And always, they both are roommates. They both have a same crush on the same boy called proximal renal tubule. If the proximal renal tubule is not able to reabsorb bicarb, what will chloride will tell? Hey, take me. So, chloride become excessively absorbed. That lead to development of hyperchloremia along with metabolic acidosis, which is typical feature of renal tubular acidosis is what you need to remember. Double bubble sign, duodenal atresia. So typically stomach become duodenum. So whenever atresia is there, what will happen? This become proximally distended. So that will have air. So double bubble sign will be found. Murphy's sign means what? If you are trying to put your hand underneath the right hypochondrium, if there is a cholecystitis, inflamed bladder, the moment he takes a deep inspiration and your lungs are inflated, that inflamed bladder will come and touch your hand and patient can't take a deep breath. Because that inflamed thing will come down, no? When you take a, you means patient takes inflation. inspiration, that will touch. So he can't take a deep breath. That's called Murphy, which is seen in acute cholecystitis. This तो very favorite question. Dentate के ऊपर क्या है? Dentate के नीचे क्या है? So here internal hemorrhoids you get here, external hemorrhoids. External hemorrhoids are painful, not the internal hemorrhoids. This is all by autonomic nervous system. This is by pudendal nerve, right? So once more, above pectinate, below pectinate. Above pectinate, superior rectal artery, below is middle and inferior rectal arteries. And inferior hypogastric plexus, autonomic plexus, is what you see above pectinate line, whereas inferior rectal nerve is what you see in below pectinate line. How much is lower esophageal sphincter? You can put finger and test. 25 centimeter of water. Temporomandibular joint dislocation. Trismus will be there, mouth will be in a fixed opening state. Treatment can be manual reduction. Most common cause of lateral recess stenosis is in the spine. Superior articular process. If you look at the vertebra, no doctor? Vertebra has got transverse process, right? One vertebra sits on another vertebra. So it is the superior articular, inferior articular process. It is the degenerative change of the superior articular process leading to spinal stenosis. If you have spinal stenosis, what do you get? Neural claudication. How to differentiate vascular claudication from neural? Vascular means if you walk, you will get pain. Stop walking and stand, you get pain relief. Here, if you sit, pain relief. If you stand, then the stenosis will cause more pressure. So that will worsen the pain. So that is neural claudication. With walking and not walking, neural claudication is not affected. Standing, sitting, it will change. Vascular claudication, with walking, it will worsen. Stopping, it will improve. Now, injury to the spinal accessory nerve will lead to drooping of the shoulder, right? Spinal accessory nerve. Trapezius and all these things are supplied, no? The most common finding in lateral epicondylitis, which is golfer's elbow, which is tennis elbow? Golfer, very good. Soft tissue calcification on the lateral aspect of elbow, like this. Soft tissue calcification on the lateral aspect of the elbow is what you need to remember. Primary anterior shoulder dislocation. How do you treat? I mean, what is the cause of recurrence? Age. With age, if typically age between 20 to 30 is the only factor associated with the 3 times, huh? That means you have 3 girlfriends, 3 times escaped. He stopped 3 of them and got 3 dislocations, huh? How is that now? Little better? Okay, good. So that's the reason I want to be a physician, not an orthopedician. Because every time he is relocating the patient's shoulder, he is Codman's paradox. It is all about the rotation of the shoulder joint. See, shoulder is a multi-axial joint. The way it rotates in different directions is basically called Codman's paradox. It is a specific pattern of the motion at the shoulder joint. How mysterious axial rotation around the longitudinal axis of the arm can occur is called Codman. All these things, no, doctor, you should recognize it. It's not there in my 1500 pages notes. That means examiner is having that satanic look at me, trying to drag me into negative marking. I'm not ready to give 15,000 check to 25,000 check to the examiner, right? Codman's paradox, Prisser's disease, Kienbach's disease, Schruman's disease, they're all osteochondritis of various locations. In scaphoid bone, when there is a avascular necrosis of the scaphoid, that's called Prisser's. There's one list, 7, 8 osteochondritis, Kienbach disease, Schruman's disease, Prisser's disease, etc. Meniscus has which type of collagen, doctor? 1. Basement membrane has type 4. Where is type 1, 2, 3, 4 is a favorite question. We'll come back. Which structure is the main stabilizer of the glenohumeral joint at 90 degrees of abduction with maximum external rotation, doctor? It is the inferior glenohumeral ligament is what you need to remember. The most common site for os acromial. One more. Bouncer, actually. So there are 4 ossification centers: preacromion, mesoacromion, metaacromion, baseacromion. First of all, os acromion, knowing it is a very, don't worry on this kind of MCQs. I will also purposefully give because we want to be like examiner. This is a sure short question. If you answer this wrong, 50,000 people will cross your head. So Jefferson's fracture is because of the axial loading. It is a fracture of the anterior and posterior arches of the first vertebra, C1 vertebra. It appears like a 3-part fracture, right? Now, nuclear cataract, if it is there, what will happen to the refractive index of the lens? Increases. It is an age-related senile cataract. Retinitis pigmentosa, what do you get? Bone spicule pigment clumps in the equator. Classical retina finding. But we don't read retina, no. Who will read retina? Lens is too much. Pass already. Glaucoma, already you get 60%. Beyond it, we develop scotoma in MBBS. So, retina. So, typically when retinitis pigmentosa is there, no doctor. Name itself says pigmentation, which is like a bony spicule pigmentation. Because of that, the retinal vessels are being buried underneath that pigment. So they look like what? Narrow vessels. The disc will be pale. And there is a bony spicule pigment clumps. That is what you need to remember. In hypermetropia versus my retinoscopy, what is that called? It's called with movement, against movement. There are 2 types we will discuss in ophthalmology in detail. Preferred initial treatment of retinopathy of prematurity in the preterm babies exposed to hyperbaric oxygen therapy is laser therapy. Rhabdomyosarcoma, what will you do? You do orbital radiation followed by chemotherapy is considered to be the treatment. Now, what is meant by Herring's law, Sherrington's law? Sherrington's law is also called the law of reciprocal innervation. Squint is there, no doctor, strabismus. There we read all these laws. What it will say, the muscle will relax when the opposite muscle is activated. When a muscle contracts, its direct antagonist will relax to an equal extent, allowing a smooth muscle. For example, if you are looking towards your left abducens will contract and your eye is moving. And in this eye, your medial rectus must contract. That means in this eye, lateral rectus should relax. In this eye, which is looking laterally, medial rectus should relax. That is what Sherrington law will do. Herring's law of equal innervation is typically will explain conjugacy of the saccadic movement in stereoptic animals. Stereopsis means you are able to perceive the depth is called stereopsis. So, I will discuss herring, Sheraton. You require a lot of images to explain that one. Ek sham beet jayega. Strabismus is one topic, doctor. We should be very good. Right? Is another topic like little gentleman, little syndrome. I enjoy teaching because vaguest topic, all imagination. Exophorias, esoporias, esotropias, hyperopias, Mannu, Mashanam. When you become Tolu doctor, dermatologist, if you become, why do you need all this stupid? For that matter, Bartter syndrome is not needed for a dermatologist. Right? But they all matter because people don't read them. Until they don't read, they don't get seat. But we read, we get seat. A dilated pupil which reacts to light shown in the opposite but not to the light shown in the same eye. Marcus gun pupil. That's called afferent pupillary defect. Winner, Dr. Sam? Simple, doctor. Light falls on your retina. There are two eyes, right? When the light falls on your retina, optic nerve carries that. Agree? Then what will it do? It reaches optic chiasma and from there it goes to midbrain. In the midbrain, what will happen? You have a pretectal nucleus. From pretectal nucleus, it will go to Edinger-Westphal nucleus of both the sides. From Edinger-Westphal nucleus, it will go to ciliary ganglion. From ciliary ganglion, it will go to sphincter pupillae and lead to pupillary constriction. Tell me, pathway. Light falls on retina, retina to optic chiasma to midbrain, pretectal nucleus, both sides Edinger-Westphal, Edinger-Westphal to ciliary ganglion, parasympathetic fibers go and innervate sphincter pupillae. So the light you have thrown will lead to pupillary constriction. Same time what happens? Because at pretectal nucleus it sent information to the opposite side Edinger-Westphal also. Even that will cause the other eyes ciliary ganglion to sphincter pupillae and make other eye also to constrict. यहाँ तक समझ में आ गया? पक्का? Assume you have optic neuritis. Then the light you have thrown is not able to go. So you don't get pupillary constriction. But you have moved the light and thrown it on the other eye. Then when you have thrown it on the other eye, then the other eye brought the light up to pretectal nucleus and it caused its own Edinger-Westphal and opposite side Edinger-Westphal and wo jaake ciliary ganglion that has gone to sphincter pupillae and that made this eye to constrict. For you, how it looks like? जब मैं लाइट इस आई के ऊपर डाले तो ये कॉन्स्ट्रिक्ट नहीं हो रहे, फिर ये दूसरे आई में डाले तो तब कॉन्स्ट्रिक्ट हो रहे ये. This is a dirty, lazy eye. When I told it is not constricting, when I moved the light, it is constricting. But when you moved the light fell on the other eye, and that made both the sides Edinger-Westphal stimulated, and that caused pupillary constriction. Could you get it? Absence of the afferent pupillary defect, where direct light reflex is absent when you throw directly light into it, but you have thrown in the other eye, then the consensual light reflex is there. This is called lazy pupillary reflex, otherwise Marcus gun pupil, which is a feature of afferent pupillary defect because of the defect in optic nerve, optic neuritis. Pakka? See, doctor, Addy's tonic pupil, Edinger Westphal, Argyle Robertson pupil, Marcus Gunn pupil. Then what else? These three pupils, doctor. All my pupils must know that. Okay? Ha. Ha ha. This correct answer my झूठ बोले कौवा काटे. Come on, what is the answer? Girija. Polyarticular. Polyarticular है? पक्का किया जाए? हाँ? Polyarticular, 50,000 rupees gone. We discussed now, doctor. Systemic, polyarticular, polyarticular. Uveitis is rare in systemic. Uveitis is uncommon in poly, but uveitis has highest association with the posse means less than 5 joints is called posse. In a musculoskeletal system, we discuss it now. Like now, fusion of cortical unification of visual objects means fusion. That means your right eye and left eye are both seeing the same person, but they both are fusing. It is artificially divided into various types. One of these types of fusions is sensory fusion. So what is meant by amblyopia? Amblyopia exenopsia, it's called as. Suppose if there is any congenital cataract, within 6 weeks, if you don't correct a congenital cataract of a newborn, then what will happen? एक आंख से लाइट आ रहे रोशनी, दूसरे आंख से नहीं आ रहे, then what will retina visual cortex will do? Altogether, that visual area of this particular eye, they suppress permanently. That's the reason you need to clear the congenital cataract early. Cataract is a problem in lens or retina? Huh? So, right. So, got it, na doctor? Congenital cataract unte 6 weeks में correction करना. अगर नहीं करे तो उस तरह की retina visual cortex में complete sensory annihilation of the area of the visual cortex given by the God. So you need to jump and treat the congenital cataracts early before the child develops a visual acuity and visual reflexes. That's called amblyopia, exenopia. Stem cells of the cornea typically are produced by what are called palisades of Watt. So, doctor, there are 3,000 points in ophthalmology, running into 50 pages and around 500 paragraphs. We take about 25 hours, not in 2 single days, but 6 into 4, 7, 8 into 3. 8 days we study ophthalmology and finally forget it. Nuclear cataract. Nuclear cataract, what will it do to refractive index? It increases the refractive. Just now we studied, no? Which factor decrease nasal resistance, doctor? If you do exercise, typically that alter the vagal activity, etc., etc. Tolosa-Hunt syndrome. Typically, cavernous sinus is there, no, doctor? Around the cavernous sinus is like our Hussain Sagar. You have outer ring road, one Hussain Sagar bridge. So, like all hotels, oculomotor nerve, abducens, everything is sitting over there. Any thrombus of the cavernous sinus will affect them. So, they have 3rd, 4th, 5th, 6th cranial nerve palsies, unilateral headache, and typically ophthalmoplegia. These are all the features of Tolosa Hunt. Patient with a superior semicircular canal dehiscence syndrome. How do you treat? You repair the dehiscence, place a tympanostomy tube, and avoid the symptoms that provoke the vertigo. Tulio phenomena, Tumarkin crisis. Have you heard of that? Huh? అవన్నీ బూతులకి వినబడుతున్నాయి సార్. టులియో ఫినామినా గాలి దేరే టుమర్కిన్ క్రైసిస్. సో వాట్ ఈస్ టులియో ఫినామినా? There is a loss of equilibrium, feeling of motion sickness, nausea. Even if they listen normal sounds also, that will stimulate all these vertiginous symptoms. If there is any superior semicircular canal dehiscence, which is called Tulio's phenomena. Tumor in crisis बाद में पढ़ेंगे, अभी energy नहीं है. Now, fluctuating hearing loss in an adult. Fluctuating means some fistulous tract, if it is there, perilimb fistula, Meniere's disease, any labyrinthitis, any of them can cause fluctuating hearing loss. You should tell me. Which drugs? We have not yet finished pharmacology. Last में सब है notes में. So cisplatinum, interferon, kanamycin, aminoglycosides, they are all ototoxic. Coming to vestibular schwannoma. Chromosomal defects can cause cerebellopontine angle tumors called vestibular schwannomas. CP angle tumors they are called. Then Heisenberg sign will be positive in them. What is Heisenberg? I leave the homework to you. Check that and tell me. Something to do with facial nerve compression by your growing tumor. You know, cerebellopontine angle area may you have all these cranials coming out of the brainstem. They become compressed and that lead to few clinical signs. Last 3 questions. Gynops छोड़ देंगे. Otosclerosis. We use fluoride for treatment of otosclerosis. So that is the reason you don't get in places where fluoride is high. One of the treatment of otosclerosis, giving fluoride. Otosclerosis symptoms worsen with pregnancy. Otosclerosis is usually bilateral. 33-year-old with fluctuant hearing loss, tinnitus, Meniere's lutic labyrinthitis, perilymphatic fistula. This you should tell. ENT we read that. What is present in anterior, inferior part of the septum. See, if we read, we answer. If we answer, we get C. Simple. There's nothing like we read and we can't answer. कुछ भी नहीं देता. Last question. Nasal bleeding. 15-year-old. 15 is the clue. Teen is the clue. 15-year-old hematopoietic disorder. Looking at answer, you say. But juvenile nasopharyngeal angiofibroma is a boy's disease. Boys are juvenile delinquents, not girls. Remember, juvenile, male, same thing, male, if it were to be, then answer would have been juvenile angiofibroma. But bleeding presentation is a problem in boys, no hemophilia. Hemophilias are more common in boys, not girls. Girl presenting with hemorrhagia, menorrhagia, or this kind of excessive nasal bleeding means which hematopoietic disorder is responsible? Look, see the leukemia under females I think. It is the most common congenital bleeding diathesis. It's a permanent design. Okay. Last clue. Last clue. It's a platelet disorder, and that is also needed for factor 8 stability. So both bleeding time and APTT both get prolonged.
12.
Huh?
12.
What?
Factor 12.
Factor 12.
10.
Most common congenital bleeding diathesis. You give desmopressin to treat it. You use ristocytin aggregation, which is abnormal in that. It is related to the platelet receptor, GP1B. Ayyo, ayyo. Block, mind block అయిపోయిందా గిరిజ? మరి చెప్పవేమోప్పా నువ్వు. అశ్వత్థామ హత కుంజర అన్నట్టు ద్రోణాచార్యుడు అన్నాడట, I will do Shastra Sannyas if Ashwadhama is died. So they all went and met Dharmaraja. నువ్వు రావా వచ్చి చెప్పు, లేకపోతే ఎనీబడి ఈజ్ ఎ లయర్, యు ఆర్ ద ఓన్లీ ట్రూత్. అశ్వత్థామ హత. Then he threw this thing. Na kunjaraha. Like that you are telling 1 millibrand disease. Anna. So now tell me, Girija. 1 millibrand. 5 times it. Punishment. 1 millibrand disease. 1 millibrand disease. 1 millibrand disease. 1 millibrand disease. 1 millibrand. What is that? Most common congenital bleeding diathesis. And what is that? Found if girls show bleeding is 1 millibrand. Inko 5 చెప్పిస్తా. And what is 1 millibrand factor? It is also important for stability of factor 8. That's the reason it lead to APTT prolongation. 1 millibrand factor is also important for the platelet to come and adhere with subendothelium. It can't adhere. That's the reason it lead to bleeding time prolongation also. And it is autosomal recessive. So it is not biased that I will only affect boys. That's the reason any female with menorrhagia or bleeding diathesis, congenitally transmitted disorder will be Jayambu Nischayambu Rabhayambu Yelara. Good. Thank you so much. The wonderful guys. You will all get seat. We don't even know what was 1 millibrand when we cracked the seat. So much better, right? So once more, there are subtypes of 1 millibrand you need to read. Which subtype lead to qualitative, quantitative? I think that time went to Karnool. You are there. Okay. Absent issues. Right, no problem. So thank you very much. Tomorrow we'll meet for continuing. We'll start biochemistry freshly and then complete pharmacology. Thank you, Doctor. And thank you, Mr. Reddy, for coming. You are most welcome anytime. Huh?